Good morning. As the director of the Forum on Public-Private Partnerships for Global Health and Safety at the National Academies, I would like to start the workshop by introducing our amazing co-chairs of both the Workshop Planning Committee and the Forum on Public-Private Partnerships for Global Health and Safety. Dr. Joe Ivy Buford, who is a clinical professor at New York University College of Global Public Health, and Dr. Clarion Johnson, who is a past consultant with ExxonMobil.
Good morning. Good morning. This is Clarion Johnson, and I'm going to make you aware of an overview from my perspective, and to thank you all for coming. A great deal of work is going into this. You've just heard Lisa talk. She has been magnificent in putting this together. There's been a lot of work that's gone into this. Hopefully, you will receive what we hope you will take away from this. And also Julie Pavlin, who Lisa works under. They have really done a great deal, a yeoman's task in putting this together, and I think that they should be recognized, and that's what I hope to do. Listen, the workshop is the product of the Forum on Public-Private Partnerships for Global Health and Safety within the Health and Medicine Division of the National Academy of Sciences, Engineering, and Medicine. The PPP Forum fosters a collaborative community of multi-sectoral leaders from business, government, foundations, humanitarian, and professional organizations, as well as academia and civil society. Our goal is to leverage the strengths of multiple sectors, and as well as disciplines, bringing discipline to explore salient models and best practices for global health and safety. Joe?
Thanks, Claire. To be a disembodied voice this morning for reasons, but I'd just like to welcome to Clarions, to all of you that are joining us today. And we're extremely excited about this group. The forum has been, and as Clarion said, to the group, to members as well as and Julie Pavlin so quickly put this program together. Looking at an opportunity for private sector involvement in academic response. I'd like to recognize especially the planning committee and the Regina Rabinovich of Harvard Teaching School of Public Health, Chris Tyler of the National Institute of Health, and Hamilton and Julie Pavlin. You will see all of them today. Just because they planned doesn't mean they got the next 2 days off, so they will be appearing in various roles. So let me turn it back over to Clarion.
Thank you. And it goes without saying, Joe Ivy Buford has been the ultimate person to work with. She has been insightful, strategic, and at all times willing to step forward. So Joe, it has been a delight working with you. But just as to begin and going a little bit more into the overview, this workshop is the way our forum hopes to contribute to the current response to COVID-19. We also hope to explore frameworks and best practices for future pandemic responses. The workshop is divided into sections that focus on past pandemic and epidemiological responses to determine what may or may not be transferable to the current crisis, as well as future pandemic crises. It also looks at what is happening in live time or real time in the public-private partnership interface. We're trying to explore what opportunities and challenges there are for establishing public-private partnership responses to COVID. We've tried to bring many members to the table. I've listed 7 of them, really trying to get a sense of what we all add, and so that each one knows what the other skill sets are. Joe? Joe?
She's currently muted. I'm asking her to unmute.
Unmute. Okay, there we go. Yeah, thanks very much, Clarion. And today, as Clarion said, we're looking at as past lessons and current practices, and then tomorrow really we'll be focusing on how the private sector can engage to really use this response to develop global public goods and contribute to the strengthening the future of global health, security, and frameworks. And Clarion, I think you're going to give people an introduction to our speakers, and I'm going to, and then we'll move ahead.
Good. Yes, it is my pleasure to do this. Again, Dr. Zhao, to me, needs no introduction. He's been my hero for a very long time, whether it was listening to him at the Copley Plaza in Baltimore, in Boston, as a young assistant professor in cardiology, and also at the Long Wharf Marriott, where I remember him also talking. He's been a leader. He's been a visionary, and his job title is president of the U.S. National Academy of Medicine, National Academies of Science, Engineering, and Medicine. And he will be followed by our two keynote speakers, Dr. Peter Sands, who is the executive director of the Global Fund to Fight AIDS, Tuberculosis, and Malaria, and John Nkengasong, who is the director of the African Center for Disease Control. Dr. Zhao, thank you, please.
Thank you, Clarion, and thank you, Joe. By the way, Clarion, your introduction is telling my age. I'm ageless. I'm not in the high-risk group. I am teasing. So it's a great pleasure for me to participate in this workshop. You know, the title is Public-Private Partnership Responses to COVID-19 and Future Pandemics. It's such a timely and important issue. And the forum co-chairs, Joe Ivy Buford and Clint Johnson, I have great respect for. And I thank both of them, as well as all the staff, for organizing an excellent program. And of course, my good friend Peter Sands will be speaking shortly. So you all know that since January, the world's been experiencing an unprecedented crisis, the COVID-19 pandemic. This crisis or pandemic is having a devastating effect on the entire world. Lives lost, human suffering, communities, and of course, it hurts the economy. And it's truly affecting everyone. Unlike many other situations where it may be affecting a group here and there, a region of the world, this is affecting everyone globally. As of today, there are globally 9.4 million cases and 480,000 deaths. And US, which is truly the epicenter, has more than 2.4 million cases and 134,000 deaths. It's a devastating number. But I think we've all seen, as we look at US and also global response, shortcomings across international response, from challenges in testing, containing the spread of virus, to health systems responses, shortage of PPE, countermeasures, and of course limitation in the global supply chain. With this rapid spread of disease and unprecedented burden on the health system, it's clear that we need an all-of-society response to the pandemic. Government efforts alone will not be enough to tackle the pandemic. Dealing effectively with the crisis will require the combined efforts of multiple stakeholders, and particularly the private sector can play a vital role to address this. I serve on the Global Preparedness Monitoring Board, or GPMB, which is co-chaired by C, who will be speaking at this meeting, and Gro Brundtland. I have members like Jeremy Farrar, Chris Elias, who will be speaking, Mohammed Patey, and others who will also be speaking. So this is an amazing meeting, bringing all these people together. In 2019, we released a report, and our job is to monitor global preparedness. And we said the efforts on national, local preparedness planning too often lack an effective whole of government and whole of society approach. Other parties that must be engaged include national agencies beyond health ministry, local governments, traditional religious leaders, civil society, research security communities, the private sector, media and operational experts. So no doubt, during a severe pandemic, private sector just will be overwhelmed. And industry assets, if they mobilize quickly and properly deployed, can save lives and reduce the economic losses. And private sector not only as donors, but they have a lot of other roles. They have experience and capabilities that are critical during emergency, whether logistics, supply chain, health, technology, data management, or financial services. They have capacity, equipment, personnel, and local knowledge of communities and cultures that can be invaluable when times is of the essence. If you look back at every pandemic from H1N1 to Ebola, there's been public-private partnerships that's emerged. Like H1N1, there's a thing called Commercial Supply Chain Dashboard, designed to improve awareness in commercial supply chain, to enhance decision-making and streamline information sharing. During Ebola, there were many public-private partnerships. The one I want to highlight is Ebola Private Sector Mobilization Group, which consists of 80 companies, 40 civil societies and governments with major assets and operations in West Africa. So this built infrastructure, donate funding, personnel, equipment, etc. And of course, the World Economic Forum, where you're going to hear from Arnold Bernard, convened several PPPs, and out of that convening was the birth of CEPI that you're going to hear later on. The CEPI, which is really a vaccine alliance to look at research, diagnostic, and now manufacturing as well. So that is in fact what public-private partnership can do. So what about COVID? Well, it's even more apparent that we need private-private partnership because it's much bigger scale, it's global, and of course, we need supply chain, which has been greatly stressed, and of course, many others. Shortages in medical equipment, surgical masks, ventilators, you name it. So I'm just going to give you very quickly, as I end my comments, a few examples of public-private partnership in COVID. First, around the vaccine, diagnostic, therapeutics area. And I know Peter Sands, many others been involved with this. At the US, there's an NIH called ACTIV, which, as you know, is a public-private partnership organized by the foundation of NIH, together with a dozen leading biopharmaceutical companies, the Health and Human Services Office, Assistant Secretary of Preparedness Response, the CDC, the FDA, and the European Medicine Agency. Together, there's a strategy starting from US, but collaborate with international efforts for coordinated research response. And of course, that has been very successful in bringing many people together to prioritize vaccines and also treatment and diagnostics. Also through BARDA, US had made relationship with Johnson & Johnson, AstraZeneca to develop a COVID vaccine plan, which intends to, in fact, not only have vaccines which are going to be, if successful, available to US, but also globally. The ACT Accelerator, or the Access to COVID Tools Accelerator, which Peter and others are part of, started with a global pledge of $8 billion hosted by European Commission. And in fact, GPMB was the first one to call for $8 billion. And we've been involved with, in fact, the hosting. Within one day, 9 countries pledged over $8 billion. This is still going a rolling pledge that I think has exceeded 11 billion and will actually end up with a big event on the 27th of June. Out of this pledge event is a parallel and converging conversation of creating a coordinated mechanism globally, public-private partnership. That includes Gates Foundation, CEPI, Gavi, Global Fund, Unitate, Wellcome Trust, WHO, and of course, the other nations to create this ACT Accelerator. So this one, in fact, is a very big deal in terms of global coordination, public-private partnership, like vaccines, treatment, and diagnostic. Now, there are many others. For example, the World Economic Forum has pulled together what they call Managed COVID, which is a manufacturing public-private partnership to enable sufficient manufacturing to enable enough doses available globally. So I've been very fortunate to be involved with so many of them, ACT Accelerator, CEPI Foundation, Formation, and many others. And in fact, one of which I'm proud of is Innovation Healthcare, which I co-launched, co-founded Davos in 2011. This forum is timely because we need to enhance and learn from our lessons and to think how we can go forward. This forum has been existing for 6 years. has done 11 proceedings and reports from their past workshops focus on a variety of issues, as you heard earlier. I think this is today, in particular, what we want to do is look at review best practices and critical action from past PPP response, explore PPPs that are currently addressing COVID-19 in country settings, examine PPP pandemic responses that increase and help navigate the distribution of global public goods, discuss PPP pandemic response that enable development of a broader global health security agenda. My colleagues, such as Peter Sands and Chris Elias, Mohammed Pateh, have been engaging, we've been engaging in discussion about how we need to look at a very different way of addressing pandemic in the future, perhaps even a different ecosystem and governance. And I think PPP plays a very important role. So thank you for putting this workshop together. I'm sure I'm going to learn a lot, and I'm going to pass it back to the co-chairs, Claren and Joe Ivey. Thank you for inviting me to open the meeting. Thank you.
Thank you, Dr. Zhang. We look forward to you being with us tomorrow morning also, sir, so you're not off the hook.
Okay.
Again, that was incredible, the wealth and breadth of what you explained and demonstrated for us. There was a richness to it, both at the 60,000 foot level as well as granular, and we're very appreciative, and what a way to start. Our next speaker is Peter Sands, who's the director of the Global Fund. Please, sir.
Thank you very much, Claren, and thank you also to Victor and the National Academy for inviting me to participate in this workshop, which, as Victor said, is, I think, right on point and very timely. I'm the executive director of the Global Fund. In some ways, I embody a public-private partnership because I'm one of a relatively small group of people who have both been the CEO of a large private institution and am now effectively the CEO of a large public institution. Although the Global Fund is a bit odd to describe because we are, I think, arguably the largest public-private institution in global health. And what I thought I'd do is share a couple of observations about the Global Fund and what we've learned from that. Second, some thoughts on what we're seeing right now in the COVID-19 response. And then third, some perspectives on how we take it from here and think about future pandemics and public-private partnerships in that context. So first, on the Global Fund itself, what can you learn from the Global Fund? Well, one, I think the Global Fund experience says, if you are serious about defeating infectious diseases of the scale and the power of HIV, TB, malaria, and now COVID, public-private partnerships are indispensable. You simply cannot do it without having partnerships that stem all the way from community organizations to small companies on the ground, to your largest multinationals, to foundations, to multilaterals, and to governments themselves. You need everybody. As Victor said, the whole of society. The second thing is, it can be done. You can unite people around a common goal and deliver extraordinary results. I think the last time we calculated it, the Global Fund in its 18 years of existence, the partnership as a whole is responsible for the saving of 32 million lives. And even more important, perhaps, the annual death toll across the three diseases is roughly half what it was at its peak. Still far too high, but a lot lower than it was. The third thing, however, I would say is it takes work. Bringing together sustainable public-private partnerships on a large scale across multiple geographies is not something that happens by accident. It takes real investment of time to understand the different perspectives and interests and constraints of different parties, and it takes care in constructing the right kind of governance mechanisms, the procedures around conflicts of interest, and all these sorts of stuff. If you take shortcuts on that kind of thing, it ends up blowing up in your face. You actually have to work quite hard to make these partnerships work. So my second topic is what are we seeing right now? Well, of course, we are seeing an explosion of fantastic interventions at both the global, the regional, and national level by private sector players of all different sorts. People have responded like I think never before to a global health crisis. And that is fantastic in many ways. And I could sort of rattle off loads of examples. I mean, I think a good example at the global level is the extent of the partnership that we're creating across the product pillars in the Access to COVID Tools Accelerator that Victor mentioned. I know Arno Bono from the World Economic Forum is on, and he's been very involved in helping us construct, for example, in the diagnostics partnership, a group of private sector partners. There's clearly one in the vaccines, there's others in the context of therapeutics. So we have an array of different actors involved, bringing innovation, manufacturing capability, all sorts. But then again, we have also got our existing partners working on incredibly sort of concrete, practical problems. So for example, Microsoft has been working with us on helping civil society groups move to operating in an online environment. Orange, the telecom company, has been helping provide 4G capacity so that we can shift medical services to a digital environment. These very practical interventions make an enormous difference. We've had Coca-Cola and the Last Mile project developing a tool to help for bottleneck analysis on supply chains. Lots of very, very practical things. But perhaps the most interesting question to me is not what's happening now, which I think is fantastic, and we should celebrate the sort of mobilization of resources and capabilities and the way people are responding together to a crisis, but how we turn this into something that is sustainable. Because my reflection, and this dates back to before I joined the Global Fund when I was at Harvard, and I was actually doing some work with Victor in the National Academy and then with the World Bank. And I spent a fair amount of time leveraging my experiences as a financier and an economist by training, trying to get people in the world of business and finance to pay more attention to the risks arriving from global health. And we held workshops at the World Economic Forum with Arno and others, and many of the companies I noticed that are on the list of speakers have been active participants, and many of them are partners of the Global Fund. But my honest reflection is that we singularly failed to really convey the message to the business and finance sector beyond those who were already knowledgeable and convinced, right? There is definitely a collection of companies, and as I say, many of them are speaking at this workshop, who absolutely understand the dynamics of infectious diseases and how they affect business and the economy. But the vast majority of companies and economic and financial institutions don't. And that is a challenge. And I have to say, I am hoping that where certainly I failed to convince economists and financial institutions and companies to take infectious diseases seriously, I think COVID-19 might prove to be a more, let's say, compelling and persuasive argument. I think people will now take these risks much more seriously. But the fault isn't all on the side of the business and financial community. I have to say, moving from the financial world into the global health world, I was struck by how little understanding and how much antipathy there was in the global health world to the private sector. It's really hard to build constructive partnerships if your working assumption as you go into them is that these people are all sort of profiteering crooks. That isn't exactly the best foundation for building a really constructive way of working together. And I've continued to be struck by the chasm of understanding. And to give you an illustration of this, in February of this year, I was getting increasingly alarmed by what was going on. And I started reaching out to old peers of mine, CEOs of financial institutions around the world, about the need to kind of change gear and to get the private sector and the financial sector to start pressuring governments and thinking differently about what was, in my mind, about to happen. And I got very little response, actually. I got a couple of people interested and engaged, and some people, for example, MasterCard moved quickly to join with Welcome and the Gates Foundation in creating the Therapeutics Accelerator. But most were not quite believing it was going to happen. And of course, it was only a matter of days before the markets collapsed and the reality of what was going to happen began to hit people. So I think what we need to do is not just mobilize to fight this pandemic, but to seize the opportunity to change the relationship between the world of global health and the private sector world. And I'm thinking particularly private sector companies and financial institutions. And to give you one last observation, just as I was leaving Harvard, I and a couple of colleagues decided to do, we inflicted on a rather dedicated research assistant the rather unenviable task of going through all 500 Fortune 500 annual reports and working out how many of those companies had climate and environmental strategies and how many of them had global health strategies. Because what we wanted to do is understand how the biggest companies in the world were looking at these sectors in comparison. And it was quite striking. 74% of the Fortune 500 companies had an explicit strategy around the climate and global health. The equivalent number, the climate and the environment, the equivalent number for global health was 9%. And if you stripped out companies like J&J and Merck and things like this, basically there weren't very many companies who really saw health as something that affected them, that they should have metrics about, that they should think about the risks about. And I think we have a challenge which COVID should be a catalyst towards to completely change that. And I think if we do so, it's not just that we can change our preparedness, our resilience to new threats, but it should be able to inject a new energy, a new momentum in the way that we fight the unfinished fights against what, if we're honest, are ex-pandemics, HIV, TB, and malaria, that we have reduced as public health threats in the richer parts of the world, but are still killing many, many people, millions of people in the poorest and most vulnerable communities. So I think there is a prize to be won, which is not just mounting an immediate, firefighting response to COVID-19, but in terms of totally changing the relationship between the health sector and the worlds of business and finance. I'll stop there. Thank you.
Thank you, thank you. You talked about two things, and before we get to the next speaker, time and care. I'd add one other thing that you brought to the table, and that's courage. The things that you've the approach you've used, the people you brought to the table is not done easily. And I'd like to say, I think that is something that's incredibly important. Our next speaker is John Nkengasong, Director of the African Centers for Disease Control. Sir?
Thank you. Let me perhaps ask the control room to allow me share some slides so that I can speak off my slides, if I may.
You are able to do so. Perfect.
So. Is it projecting there?
Not right now. You have to hit share screen, the green button. And then all the way on the right of the box, it says share in blue. Once you click that, we will be able to see your screen.
Okay.
Perfect. Now just a presentation. Perfect.
Okay. I'm assuming we have it.
Looks good.
Okay, good. Thank you. I just thought I would use some slides to make my presentation, not necessarily from an epidemiologic standpoint, but to make the case that partnerships are always objectified towards solving a problem. And in our situation in Africa, on the continent as we speak, I see partnerships public-private partnerships playing a role in 3 areas. First, to enable us scale-up testing. Secondly, to allow us to deploy responders very broadly. And lastly, in the areas of vaccines. So those are the 3 areas that I would like to share some reflections very quickly. And the slide you see in front of you here is an interesting slide. It shows a C-130 plane standing there at the airport in Kinshasa and transporting, and that C-130 plane is from Cameroon, donated by Cameroon to pick up responders, COVID responders from DRC, and they're all in green, Africa CDC responders, and they are going to deploy them in Mali, Niger, Burkina Faso, and Burkina Faso. I think that is, when we talked of public-private partnership, I thought it's important to start with the public sector, showing how some of these partnerships are enabling us to meet certain needs for the response to COVID-19 on the continent. And this is facilitated through the Peace and Security Council of the African Union, which for the first time they are doing this in the spirit of partnership between the Peace and Security Council and the Africa CDC and member states. It will require, because airspace is all locked across the continent, it will require that we engage with series of countries to allow us fly through their airspace and deploy these responders. So I think that is important, as I will highlight in my talk, if I can get this slide to move.
Might have to click the slide.
Okay, please, it's the next slide. So if I may just then go to use a few slides to highlight where we are with, are you changing it from there or from here?
I'm not able to control it. With your mouse, you have to click the slide and then try to move it forward.
Okay, so I think our pandemic is gathering pace. As you can see here, we are really rapidly increasing, and the different colors you see indicate the 5 different regions of the continent. And as you likely see, there is North Africa and Southern Africa that are leading the charge with a weekly increase of about 17% to 27%, resulting in about 336,000 cases with about close to 9,000 deaths. Now, if you look at it in terms of the steepness of it, I'd just like you to focus on the graph on the right side. It shows 2 colors there. Yellow colored are the number of cases, which are indicated about 330,000, and the red bar represents the number of deaths. What I really wanted to do here was to show you how the continent has changed rapidly since April and May, and now in June, you can see a very steep increase in that number. So it's important to look at what is it that we can do at this point that we still have a chance, because even though those numbers are increasing, about 10 countries are really contributing to that. About 40 countries still have less than 5,000 cases there. So the optimistic message here is that with the appropriate partnerships, you can really work with these 40 countries and make a big difference, and as well as look at innovative strategies to engage with those countries that are seeing an explosion of the number of new cases there. Now, the testing is really a challenge on the continent, and this is an area of partnership that is greatly needed both in the private sector engagement and the public sector engagement. As of today, we've tested as the continent, conducted about 4.3 million tests, and that represents about 3,000 tests per million population. And that's, again, if the curve shows that we are in the right direction, but we should have tested about 13 million tests on a continent of 1.2 billion. So there, again, there's a huge avenue for effective partnership. And as the continent begins to ease off the lockdown processes, we expect to see what is happening in other resource-limited settings happen in Africa. The graph on your left side shows Latin America, with Brazil leading the charge. And then on the right is South Asia with India. And you can see other countries also, their curve moving up very quickly as the lockdown begins to be eased. So that means for us on the continent, we have to develop new strategies. So we just launched what we call a partnership engagement called Partnerships to Accelerate COVID Testing in Africa, abbreviated PAC, which is underpinned by the ability to test, to trace, and to treat. And our target initially, when this was launched, that was 6 weeks ago, was to make sure that about 10 million tests were conducted, that 1 million community health workers were deployed to support contact tracing, that 100,000 healthcare workers were trained, and then a procurement platform was launched. And just to tick the boxes, the one procurement platform has actually been launched, and that is a good example of a private sector engagement where a private businessman in Africa took upon himself to develop an Amazon-like or Alibaba-like structure that will enable countries to go into that platform and procure diagnostics and as well as PPEs. That's a very good example of a private sector stepping in to solve a problem that the public sector could not. And that will hopefully unlock the supply chain management issues there. The other areas, the 10 million and the 1 million community workers, we see MasterCard and other Gates Foundation and others weighing in to support these very important goals there. Those are very good example of how we see public-private partnerships coming in to address a specific problem. Let me just transition then to the third and the last component, which is the need for partnerships for vaccine. What you are seeing in front of you is a slide that summarizes our continental strategy, which is underpinned by 3 goals: to prevent transmission, to prevent deaths, and to prevent harm, including social harm and economic harm. Vaccines is at the center of that. And we recognize as a continent that we need to have make sure the continent is ready for vaccines deployment, because that's the only way to ensure that our economies and societies return to normal. And then, of course, our developmental agenda, including protecting the vulnerable. So we all know that we all hoping that we'll have a vaccine. We may not, but we are hoping. But the race for the vaccines have started, and we have to, as a continent, rely on public-private partnerships in so many areas in order not to be left behind when the vaccines are available, that 8 billion people will be looking forward to having the vaccine. So we just, as we speak since yesterday, have been organizing a very large meeting with the president of South Africa, the chairperson of the African Union Commission, ministers of health, looking at several areas of vaccine access and development on the continent, including financing, access and procurement, manufacturing, clinical trial networks, regulatory issues, delivery systems, and uptake. As I actually speak next door, we are concluding a 2-day meeting there where nearly everybody on the continent has taken part in it. I show this slide here to highlight potential areas where you will need public-private partnerships to ensure that there is access to vaccine on the continent in a timely fashion. We at Africa CDC have been given the charge by the African Union to look at these very areas there that I just highlighted, and below are very specific of things that we need to put together to enable at least the creation of a COVID-19 Africa Vaccine Clinical Trial Network, stand up a vaccine regulatory working group for the continent, and begin to look at ways that it can support countries to strengthen systems and prepare for vaccine delivery, and very importantly, the community. Each of these will require innovation, which will definitely come from the public sector, but also from the private sector. Let me just share this slide to show some very short-term and medium-term goals that we are fixing for ourselves. Again, the same items are listed on the previous slide, but categorizing them by what we must do in the first 6 months and what we need to do in the next 6 months. I will just conclude by saying partnership is so critical, and I did not throw this slide here to list people we are working with, but rather to say that we will need to develop partnerships across the board, and including new ones that will enable us to achieve the 3 areas of interest that I mentioned, i.e. scaling up testing, deploying responders, as well as preparing for vaccines. Thank you for the opportunity to participate. Unfortunately, very unfortunately, I have to run to the next room to close the vaccine meeting we are hosting, so I wouldn't be able to stay longer after this. Thank you.
Thank you very much, both of you, for terrific talks. And I'm sorry we'll lose you, Dr. Kangagong, but we'll hopefully have you back another time. I think the important work next door is obvious. I wanted to ask, I don't know if you have a minute or two, seeing your picture in the room. One of the issues that was raised, just a very opening question, because while we have the 2 points of view, is the question of the question of sustainability of partnerships, developing partnerships for emergency response being not easy, relatively easier, sustaining partnerships. So perhaps I could ask you to go first and just identify what you think are really the critical factors in sustaining partnerships in your experience. You could just tick off
You might have to repeat that last part, Joe. You just cut out.
Hello, Alex, is she still there?
She is still there.
Yeah, I think you're, I know I'm opening it. Please go ahead. Dr. Nkangasong, if you could just go ahead. Did you hear the question? I'm sorry.
What, I mean, let me see if I got the question right. What is...
Oh, I can repeat it. I'm sorry for this interruption.
Yes,
no, I was, Stan indicated, obviously the hard work challenges of developing partnerships.
Joe, you might have to send me a copy of the question, or someone else, because you keep breaking up.
Okay, I can't do that quickly. So why don't you go ahead, Claren, with the next question. It was really about the key factors and sustainable questions and sustainable partnerships from your point of view.
Yeah, I think I hear the question. Perhaps, in my view, the most critical factor in sustaining partnership is a common interest or a shared a vision or interest. So I think that is in my previous job and life, I think what was very important when we developed partnership with Becton Dickinson, with Roche, with Siemens, was a shared interest, a common interest to achieve a common goal. I think that's the main thing. The public sector, especially in public health, we have to begin to look at the private sector a little bit differently other than a sector that will provide money to fund things, but really that they can participate actively and implement some of the programs. I think a shared and common interest is, I believe, a determining factor in a sustained partnership. Anyway, good. Thank you once more. I'll have to run.
Okay,
Thank you. Dr. Sands? Joe, you're continuing to break up. I apologize. Please send something.
Same question.
Okay, Dr. Sands, I have a quick question for you, and it's from one of our panel, one of our people in the chat room, and it's from Scott Razan, and he says, we seemingly failed at the vast majority of institutions and companies, and institutional companies are not engaged. Yet the failure is not all on the side of business and financial community. Could you talk about that a little bit more?
I'd be happy to do so. And can I start actually by just building on John's comment about sustainability? Because I think this issue around making partnerships sustainable and assuring there's a common interest. Look, the motivations for companies in responding to a global crisis are not ones that are necessarily going to automatically see them through doing the same thing 5 years later. If they're going to be doing things over the longer term, it's got to be consistent with their mandate to deliver value for shareholders. And that's what we need to work out how to change, is to make sure that private sector institutions see this not just as an emergency response, a charitable impulse, a bit of corporate social responsibility, but much more part and parcel of their core mission. And that has to be true. It can't just be an artifice, a contrivance, if it's going to be sustainable. And for that to be true, it requires their understanding of the risks that health issues pose to their commercial mission to be more articulated. But it also requires their global health partners to understand what it is they're trying to achieve and how the global health issues interface with those achievements. And that requires a degree of communication and mutual understanding. I also think having very clear goals really matters. And I do think, actually, John and I have been working together a lot on the COVID-19 response in Africa. And I think one of the key examples of how you need clear metrics is the question of what constitutes success in responding to COVID-19 in Africa is not a trivial question. Because my worry is that actually in Africa, partly because of the demographics of the continent, where roughly 3% of the people are over the age of 65, and we all know that COVID is highly correlated in severity with age, that actually, if you take that factor and you add the scale of the disease burdens from other conditions, you could well have a scenario where the indirect impact of the knock-on impact of COVID-19 on incremental deaths due to other diseases is actually greater than the direct impact. We don't know that's going to happen, but it's certainly not implausible. And if you've seen the kinds of scenarios that various people have been modeling around HIV, TB, and malaria, they are truly scary. They raise the prospect of us losing a decade of progress across the three diseases. And so I think that when we measure success in the parts of the world where that balance of COVID severity and indirect impact is like it will be in many parts of Africa, we need to measure success in terms of the total mortality saved, essentially, the total lives saved, not just those who happen to test positive with COVID. Turning just lastly to the question, I think Scott was actually quoting me here. The challenge we have, I think, is multidimensional in the sense that, yes, and Scott's now written another comment on it, in that we need both the institutional incentives for people on both sides of the public-private to work together in a sustainable way. Perhaps we need more people also to do the kinds of career switch that I've done, and you can do it either way. So you were very complimentary to me in calling me a doctor, but I'm not a clinician or a scientist at all. But I'm a firm believer in if you can mix people from different sorts of backgrounds, a diversity of experiences, not just of functional expertise, but of knowledge and coming from different parts of the world and different backgrounds, you get a better result. And I do think that perhaps the business world and the global wealth world haven't cross-fertilized enough. And we need more of that interchange if we're going to build the kinds of partnerships that will really make a difference over the longer term. Thank you.
Clarion, I was able to get in, so maybe I can jump in for the time being to another question. Let me ask Mr. Sands, one of the things we've been talking about a lot in this forum is the notion of SDG 17, in a sense, being an invitation to the private sector to engage in ways that have not previously occurred. And your comments, you talked about the need to, you've just mentioned that the issue of people moving from sector to sector would be helpful in terms of explaining that, or potentially seeing common interest in terms of the socioeconomic upheaval that we've seen actually as a result of COVID and infectious disease. But do you see any, I mean, you at running the Global Fund are kind of a platform for engaging these sectors together productively. Do you see other bridges like that that have been built by UN agencies or could be built in government examples? This issue of bringing these groups together to get to know each other, to be able to talk to each other, to be able to develop partnerships. He's muted.
Yeah, sorry, it's my fault.
It's okay.
There are a lot of partnerships, and actually the response to COVID has catalyzed more, and the Africa CDC AU partnership with private sector partners to build a platform, the Africa Medical Supplies Platform, is a really good example of something that wouldn't have happened without COVID-19 as a catalyst. I have to say, though, that a lot of these partnerships are self-limiting in the sense that they don't really fundamentally change the nature of the institutions and change the nature of what is being done. And I certainly think that's a challenge for quite a lot of the UN agencies. I think one of the advantages that institutions like Gavi or CEPI or the Global Fund have is we have a degree, we're not part of the UN system, we have a degree of freedom around our governance structures and so on. And so we have the private sector on our board, we have civil society on our board. They are involved in decision-making at every level of the organization. And that's a very different level of engagement that you would typically get in a UN entity, which of course is a member state entity, and therefore the primacy is of the accountability through to member states. And so I do think that if you have institutions like Gavi and CEPI and the Global Fund, one has more degrees of freedom to play with in creating mechanisms, governance mechanisms, and so on that can accommodate the very different perspectives and interests that you get when you're trying to bring together people from different sort of parts of society against a common goal.
Oh, you're on mute right now. I'm sorry.
Sorry, Clarion, do you want to take the next one from the audience, or?
I was trying to get, I didn't see one from the audience, but I did have a question for Peter Sands, who I did call doctor, and that's a compliment. If you were to start a course, and people did not wear 3 hats as you have successfully, what would be the parts of the course that you would use to make sure to get everyone on the same page? What are the basic elements people need to have when they sit down at the table to do a PPP?
I think the first thing you need is clarity on what you're trying to achieve. And one of the things that I think has made the Global Fund so successful as an institution, and I say this as a person who can't claim much credit because I've only arrived, a couple of years ago. So most of the achievements of the Global Fund predate me, is clarity of objective. And I think in the world of health, there is very little better to motivate people than saving lives. And if you can save lives, and then you problem solve backwards from that and say, what has to be true to stop people dying of COVID, to stop people dying of HIV? And what you discover is that it's a complex mix of scientific problems, clinical practice problems, logistical issues, community issues, human rights issues, behavioral issues, communication issues. And once you start getting into that, you realize that you need an array of different skills and capabilities, and no one type of institution is going to be able to deliver that. So partnership is essential. In terms of the attributes of partners, I think the first thing you have to have is a sort of combination of knowing what you're good at, knowing what you can't do, and respect for others who can do the things that you can't do, and a willingness to work with people, and a sort of give and take attitude. And there's a bit too much. In the multilateral world, there's a lot of collaboration in inverted commas, where one side sees collaboration as having the other institution do what we want to do anyway. That isn't really true collaboration. Collaboration is actually going out of your way to help somebody else do something that they want to do. And so you need that kind of spirit. But I think the problem is, what you actually often have is you have people with willingness, but they actually haven't come together around a shared goal. They've got slightly different or divergent goals. And if you can focus people around the shared objective, you can normally overcome some of the other things that are pushing and pressuring people in different ways.
Thanks. We do have, I need to remind everyone, we do have a feature. Those that are listening in the listening audience can enter a question for our speaker, our now speaker, in the Q&A section. So I'm going to take one from the public. Peter, there's a question for you. People are asking, are you seeing, I guess in the context of the Global Fund or other work, that healthcare companies are actually backing away from Africa? That's really the question Kamiar is asking.
We're not seeing healthcare companies backing away from Africa. We are seeing some healthcare companies reprioritizing their efforts across diseases, and that's quite disconcerting. It's understandable. COVID is a huge priority, but we also need to ensure that in the rush to do things to prevent COVID killing people, we don't inadvertently end up having other things killing people. I mean, there's a very practical example of this, is that quite a bit of those tests that John talked about, those COVID tests, a non-trivial percentage of them have been provided by the Global Fund. We have bought them, and we've focused on the automated PCR tests. And these are using machines that we have put in place, either sort of Abbott M2000s for viral load testing, gene experts for TB diagnosis, and so on. And that's great. You know, it's better, you get better quality than doing manual PCRs and so on. The issue is, though, what we don't want to find is that we're no longer doing any viral load testing because the machines are and the technicians are spending all their time doing COVID, and we're no longer doing TB testing. So one of the things we've been doing is working with the countries saying, if we're going to give you COVID-19 tests to run on a gene expert machine, we also want to have a discussion about what needs to be true to ensure that TB diagnosis keeps going. Is it more technicians? Is it actually more gene expert machines? What's the adjustment factor? Because I think my worry is that in the completely understandable desire to mobilize both clinical tools, resources, infrastructure in the COVID response, is that we also need to manage the knock-on impact of that on the other diseases.
Clarion, you have a question?
I was just going to ask, when you were sitting down to bring people to the table for an issue that requires a PPP, do you have do you explore the metrics that are essential to the particular industry or partner you're inviting? I mean, how much homework goes into who sits at the table?
I think that's a very good question. And I think you do have to understand what motivates the partners. Now, a lot of the partners we have as a global fund, I was looking at some of the list of speakers here, people like Paul Stoffels at J&J or Merck or others. These are companies we know very well, and they know us very well, and we understand each other and the way we work very well. When you start engaging with newer companies, there has to be a bit of a learning curve, where the Global Fund is a bit of an odd institution. There's nothing quite like it. They need to come up the learning curve to understand what it's like to interact with us. But we also need to make sure we understand enough. And I suppose one of the things that I've been able to bring is the perspective of having been a CEO. And I can talk to the CEOs of the companies we're interacting with, kind of understanding what their constraints are and the kinds of things they're going to be worried about, because I've been in that same position. And I think the more of that mutual understanding you build pretty early on in the relationship, the better, because then it gives you a bit of resilience when things go wrong. And I always work on the basis that in any partnership, you have to assume something's going to go wrong at some point, right? And the question is, have you built in enough mutual understanding and resilience so when that inevitable thing is, and who knows what it's going to be, that it doesn't lead to a sort of dysfunctional bust up, but it's solved. People understand that things go wrong, and they sort of pick themselves up and work together to go forward. I don't think there's a cookie cutter solution. I think people in the global health world sometimes think all private sector companies are the same, and people in the private sector think all global health institutions are the same, and neither is true. These are very different types of thing, and so that investment in understanding each other and also agreeing on what the objectives and metrics of success are is really, really important.
Let me ask a question. It's a sort of hybrid of one that's coming through from the audience. Talking about kind of starting, John mentioned an African entrepreneur, if you will, developing a platform that could help people, identify where to get resources that were necessary to respond to COVID. And one of the questions that we've been discussing as a forum are really the degree to which companies can really build capacity for business closer to the problem locally, really in low-income countries and high-income countries. Are you working? Is that part of your strategy as you look at deploying resources? I know plans come in from countries to handle particular issues, but you have inserted things like workforce and others over the years, but this issue of developing or supporting local business development, sort of local potential private sector partners that might have previous relationships with government or with NGOs in that particular country or in that community, and be able to take off, the PPP might take off more quickly.
Yeah, and I would say we've done some, and I think we should do more. I mean, Strive Meswara is the guy who has injected a fantastic amount of energy and practicality into driving this medical supplies platform that John was talking about. And interestingly, I've known Strive from my previous career, and he's a fantastic focused person who, when he wants to get things done, he will just make things happen. We at the Global Fund are now very much engaged with this and trying to support and develop, because we think that it's a really good idea to have for Africa to have, as a sense, not a global public good, but an African public good of a consolidated platform for medical procurement. We have a lot of capabilities in that space. We can link up and develop and help strengthen that. We're also very interested in the context. I'm a co-convener of the diagnostics partnership in ACTA, the Access to COVID Tools Accelerator. And a couple of the sort of strands we're very focused on there are how we think about stimulating local production of diagnostics in many places in the world, or not many places, but at least not just in the very few that they are produced in at the moment, but also how we help build both public and private capabilities in laboratory networks, which is a very scarce resource. And then perhaps less glamorous, but equally important, PPE, personal protective equipment. It really doesn't make an awful lot of sense to be flying masks around the world. One would prefer to be producing them closer to the places in which they're being used, but to an appropriate quality. And also because actually the environmental conditions, the temperature, the humidity and stuff are different in different parts of the world. And so the optimal design of the mask should be different. And so I'm quite interested in seeing how, in partnership with the World Bank, because we are not geared up to set up this kind of thing, but you've got organizations like the IFC, you've got organizations like CDC who are much more set up to support the development of local production of these sorts of things. What we can do is, in a sense, make sure there's a customer. So we can fund the governments and so on who are buying these things. The last thing I would say is the bit that I think we all need to do better on is actually private sector health providers. In many parts of the low and middle income world, actually most people's interaction with the healthcare system is not with the public health system, it's with private sector healthcare. And if you want to be controlling a pandemic, you have to make the private sector health providers part of the solution. We've done a ton of work on that in places like India on TB, and we're using that as a sort of starting point for the engagement on COVID. But I think more generally, the responses to infectious disease outbreaks have to embrace private sector health providers.
Are there examples where that's been particularly effective? You mentioned one country, but I know many of the issues that, again, we've discussed in this forum have to do with the issues of regulation, the positives and negatives in some ways of, and this becomes especially true in the personal healthcare delivery system, in the sense of potentially having separate private sector, separate public sector, not having the same standards. Could you talk a little bit about regulatory issues? Are they helping? Are they getting in the way?
No, there's a ton of there's a ton of issues here. I think one of the challenges is every country's medical system and the way it combines the private providers and public providers appears to be unique, right? The funding mechanisms, the shares of what they do, the who does what and how it works and what it's regulated. And so you can't really say there is one best practice and then just kind of roll it out. It's not like saying, you know, the dolutegravir is, you know, TLT is the best regimen, first-line regimen for antiretroviral treatment. Let's just make sure everybody does this as far as possible. These solutions have to be crafted within the history and the context of the particular country's environment. And I think we and all our partners need to think through more effectively how that is done in a systemized way. The reality is, I would say most advanced countries, most OECD countries struggle to do it well, right? So this is not unique to the lower middle income countries. But I would say that the most striking great example I've seen in the last couple of years has been the work between the public and private sector in India on TB case identification, where a combination of government and private providers work together on a sort of very combined campaign to close the gap between those falling ill with TB and those actually being diagnosed and treated. And we saw a very sharp uptick. And this is a good example of the impact of COVID is we have also seen a very sharp reduction in the case identification rates since COVID, because it's very difficult at the same time as you're telling people with respiratory symptoms and fevers and things to isolate and not come to a clinic, to be also trying to run programs to find those people and bring them into clinics, right? That's a very difficult mixed message. And you've also got the same gene expert machines being diverted to COVID testing. And also in most parts of the world, the doctors and nurses who are specialists in respiratory infections have been moved from things like TB to COVID. So you've got some real challenges in ensuring continued momentum on TB programs in an environment where COVID is kind of both confusing the message and competing for resource.
One other question, Clarion, I'm just gonna take just one other question from the audience while I have the mic on. Really a question that you pointed out earlier, obviously shifting of donors from disease to disease, but also the desire to help support, entrepreneurs or more local manufacturing. The question really has to do with for entrepreneurs, obviously in startups, the pace of available funds is important. Do you see trends towards really recognizing the need to move funds more quickly? Is that something you're looking at taking on, others are taking on? Just to comment on that issue, the sort of the pace and timing.
No, I think it is a real issue. We are not, the Global Fund is not set up to finance sort of R&D and market entry. We're set up to finance deployment and delivery. So for example, I co-convene the ACTA Diagnostics Partnership with Katharina Boehm, who heads FIND, the Foundation for Innovative New Diagnostics. She very much is at the upstream end. I'm very much at the downstream end. But the issues of speed, I think, are important across the spectrum. I mean, we, at the Global Fund, we decided at the beginning of March, right at the beginning of March, we introduced a mechanism that basically made up to $500 million available to countries to spend on COVID. And it was money that was, we did a 2-day turnaround time on applications for it, and the money was there. And then we decided that wasn't enough. So in April, we designed a different scheme that essentially tapped into a different pool of money that made another 500 million available. And that is running on a slightly longer, because it's a slightly more complicated process. But again, I think our turnaround time is 10 days. But we very much took the view that money now is worth a lot more than money 3 months from now. Because money now can buy the test, buy the protective equipment, help people mitigate and change HIV, TB, and malaria programs. I mean, for example, on malaria, we have over 30 malaria bed net distribution programs running in different parts of the world this summer. We are absolutely determined to make sure those happen, because the modeling is so clear that if they don't happen, we will absolutely see rises in infections, rises in child mortality, and these will not be small numbers. These will be significant increases. And so we've been trying to get the money out as fast as possible. And when I mean fast as possible, I say 2-day turnaround times on money. And again, I think this is one aspect where the Global Fund is a bit different from a lot of multilaterals, because we kind of can move at that kind of pace.
That's great. That's incredible. I think we've run out of time for this incredibly interesting session. Let me thank you for your contributions, for sort of manning this session yourself and answering questions so honestly and straightforwardly. I know it's been incredibly helpful to the audience. So let me thank you and turn it back over to Clarion to move on to the next session.
Thank you very much. Thank you. And I enjoyed the conversation.
Thank you, thank you, thank you. Our next session, for session 1, our Our speakers are Alan Knight, who is the general manager of ArcelorMittal and the secretary/chair of the Ebola Private Sector Mobilization Group. And the additional speaker is Michael Osterholm, who is the director of the Center for Infectious Diseases Research and Policy at the University of Minnesota. Please.
Okay, and I have the pleasure of introducing the moderator, who will kick us off. John Monahan is a member of the forum. He's a senior advisor in global health to the president of Georgetown University and a senior fellow at the McCourt School of Public Policy and senior scholar at the O'Neill Institute at the Georgetown Program in Health and Law. So John, over to you to perhaps kick off your session.
Sure. Thanks, Joe, and thanks, everybody. We have a terrific session coming up. I'm not sure why the video doesn't work, but I'll figure that out after our speakers get started. So let me, a couple thoughts, just to provide heads up to everybody on the that's participating is, one is we're going to have, first Alan will speak, and then Mike Osterholm, and then we'll do a few questions, but I really want to encourage forum members, if you have questions, to put your questions in the chat segment, and also encourage people who are outside the forum but are joining us today to ask questions in the Q&A. We'll try to get to those, as many of those as we can as well. So, but let me just say just a bit of framing. As Clarion indicated, the goal of this segment is to take a step back and reflect a bit on public-private partnership frameworks in previous public health crises and try to understand to what extent they could inform our discussion going forward. So two thoughts come to mind before we turn to our speakers. It seems to me, when you look back at history, there's at least a couple things you want to take away. One is you want to avoid repeating past mistakes, build on what works, and essentially make new mistakes going forward. And second is sort of the classic, you want to avoid the risk of fighting the last war. You know, the over-learning from the past and not recognizing what's new and focusing on what's different about what's in front of us. I think our two speakers are going to really help us think through at least those two things and many other perspectives. But I just wanted to offer that as potential framing. So let me, with that, I'm going to ask Alan, who I believe has got a slide deck that he's going to share with us, and turn it over to him and thank him for making his time available. Alan, over to you.
If I can show you my slides, that's the old deck. I've got a new deck. So Can I share screen?
I believe you can. I'm going to ask Alex, who's our technical coordinator, to comment if he could.
Okay, you now have the ability to share your screen.
Please go ahead, Alan. Thank you.
Right, you should see a slide which looks similar to the one you just saw.
You would have
thank
to
you very
press.
much.
Sorry, we don't see it currently. You would have to hit share screen at the bottom of the Zoom screen, and then all the way on the right in the next box, it says share in blue. Once you do that, we'll be able to see your deck.
Yes, green.
Yep, and then in the right side in blue, it says, yep.
Oh.
Perfect, and then just full screen that, and we should be good to go.
Great.
Alan, does that work from your end?
There we go. Thank you. Yeah, perfect. Right. So I join you.
Sorry, right now
Yeah,
it's still
I
not
can
in
see
full
everything.
screen.
Yeah, so I join you as head of CR for a company called ArcelorMittal. So I am sharing screen.
Yep, yep. Okay, perfect. Now it's big and yep, perfect.
So can you see it now? Did the slides just change?
Yes, indeed, it's working.
Looks great.
Thank you.
Great, thank you. Sorry about that. So I join you as head of CR and sustainable development for ArcelorMittal, the world's largest steel company. Our interests in Africa are mining operation in Liberia and associated infrastructure, railway tracks, and a port. And so I was asked to really talk about the work we did on Ebola, but I'm going to slightly expand my brief with permission from the host, which I got yesterday, to talk about some other experiences. Because one of the things which struck me was I am a head of CR. I've done several jobs throughout my career, and pandemics aren't new. So for many years, I worked for a retailer who was buying products from South Africa, and so HIV was on our agenda. Then I worked for SAB Miller, South African breweries, when it was part of a different company it is in now. And as head of CR, I had two people working for me who looked after our response to HIV. And by that, it was how we looked after our employees who were HIV positive or hadn't been tested, but had known they'd taken risks. So how we managed the whole issue. I joined ArcelorMittal, the group, in 2014, pretty much in the same month as Ebola started to have an impact on our site in Liberia. And so for about 6 months to a year, I was pretty much full time on helping coordinate our response to Ebola. And now I'm on various response groups, be them internal, but also again in Liberia, on how we are managing COVID. And so I've sort of seen this through three optics. But the first thing which struck me the most when I was sort of thinking about these slides was the extent to which my profession as a head of CR, I've had, you know, epidemics, pandemics, global disease outbreaks like this as part of my day job, as it were. And I just wanted to share with you some of the work we've done and some of the experiences and learnings I've gathered from that. So my top line observations are those diseases are very different if you're a scientist studying the disease, but I've been struck just how similar the optimum private sector response to each of those diseases are. You know, it's about protecting employees, it's about our relationship with the local communities and other similarities. And that's always struck me as just actually, yeah, the diseases are different, but how we respond are very similar. I've also been struck just how the potential contribution of the private sector has been misunderstood and, more importantly, probably seriously under-leveraged. That's not a criticism of anybody, if only probably the private sector itself. But there was an awful lot we've done, and I'm sure there's an awful lot we didn't do, which we could do if there was better coordination of the contribution of the private sector. And I mean logistical support and other social and economic interventions to both prepare and manage these particular outbreaks. So my sort of overall thesis is that the private sector potential contribution is undervalued and poorly leveraged. So let me just give you an example of what I mean. So a company like ArcelorMittal in Liberia will employ about 5,000 or 6,000 people, and 99% of those people are Liberians, employees, citizens of the country. They have families and they live in communities and have their own networks. And that's before you even consider things like the supply chain and the customers. And if you think of the three diseases I've had some involvement in as a private sector player, HIV, Ebola, and COVID, in each of them, we've had to actually, in informing our employees, give very, very difficult messages. You know, HIV was conversations about people's private lives and the impact that has on their family. Ebola was, you know, conversations about funeral rites and, you know, not doing body washing and all of that. And COVID-19 from washing hands, but to stay at home. You know, these are massive interventions on people's private lives. But if one of our roles is to educate our employees on these diseases, how they work, and what you need to do with your own personal behaviours to reduce your risk of catching them, the ask is the same. We as an employer have to find the best ways of giving difficult messages about our employees' lifestyles, how we navigate the boundaries of work life versus private life to help them protect themselves and therefore protect the company from the epidemic. And once we've done that well, of course, that message by default will cascade to the families and communities. So whilst the ask is very different, the actual ask is very different, the process of what an employer has to do is the same: deliver a difficult message. And I just wanted to highlight here that people always talk about the private sector, and the private sector falls into three groups. Now, to some, this might be obvious. The first regions, and that's what I'm really talking about. So what I'm talking about as a company in Liberia could be very similar to a mining company, a palm oil company, or a bank. It's how do you, with an operation in that country, protect yourself, manage the pandemic, and actually make your contribution to the wider world. Other private sectors are companies who make medicines and medical intervention equipment. Their contribution is vastly important, but very different. And of course, any company in the world can provide cash to actually help fight the disease in the region which it needs. They're very different, and the asks of those different bubbles is fundamentally different. My focus and experience is businesses who operate in a region and what their contribution is. So with HIV, I sort of listed it. There were various things we had to do, from education to peer-to-peer discussions to help overcome stigma. We actually provided medicines for positive cases. We provided medicines for families who had also picked up the condition. And yeah, a lot of work on stigma and declaration of status. And it was a fundamental part, and was, you know, from the day I joined ArcelorMittal and I inherited the program, it was part of CR, it was the way we did business. And very interesting that when we did the analysis, if we did it on a quite hard business case analysis, it actually made us more profitable by looking after our employees than sitting back and letting them, you know, suffer from the disease. And we saved thousands of lives by doing this, or extended the lives of thousands of people, and probably stopped a lot of people from catching the disease. So it was a powerful and important intervention. I then found myself working for ArcelorMittal, as I said, joining in 2014, when it was clear that there was a problem with Ebola and that the numbers could get very serious very quickly. We had already got our business prepared for Ebola, because we used the best practices of risk management. So we employed experts on the disease. So we employed doctors who told us about the disease, and we'd already started doing the literature, the education. We actually had people washing hands. And so we were very Ebola ready before it even struck the country. And by doing that, we were protecting 6,000 citizens, and we were passing the message down to those communities. And it also enabled us to carry on running our mine during the worst of the epidemic. So we made our contribution towards supporting the economy. But my most important point here was, by just protecting our own people, by default, we are protecting many, many citizens and their family groups and their social groups and their communities just by what we're doing. So a very, very important contribution. And if you imagined if every big or medium-sized company in these regions did that, what a big difference it would make. Very straightforward, very easy to do, and it's following the basic principles of risk management, good communication, and the ability for businesses just to get on and do things and move very quickly. But what we also realized in March was being a company which was protected from Ebola was no more than a company who'd put a big fence around their plant, but we weren't really making a contribution in fighting the disease in the rest of the region. And we're very struck, if you remember, at that time, people were talking about potential of 500,000 to 1.4 million cases of Ebola in Liberia alone. So the curve projection was really scary. So we then decided, what more do we need to do to make our contribution as a company who is a mining company, not a medical company, in fighting the disease? And what we recognized was we were just one company, and we hadn't even spoken to other companies, and we didn't even really know what our intellectual, let alone practical contribution could be. So the first stage was actually just to talk to our peer group. So we hosted a meeting in London. We got London representatives, the companies with interest in West Africa. All people dialed in. It was only 11. It was pretty much like a sort of a morning coffee chat. We just talked about this, and we worked out what we should be doing. And we were all shocked just how little we'd spoken to each other. And we were all very sort of empowered on what we could do if we spoke with a single voice and we shared experience with each other. So what emerged was something which ended up being called the Ebola Private Sector Mobilization Group. And the model was very simple, that in each of the 3 impacted countries, there would be a country group which focused on actions and problem solvings. And we would have a regional platform which focused on sort of advocacy and shared learning. And by the end of August, we'd already had a meeting with the Director General of WHO and the politics, the ambassadors, the United Nations also engaged with us and got very involved. To the point that by September, we actually started having a voice. We had a single voice, and we started making statements where we were sort of providing narrative and commentary on what we felt as the private sector with a reach across the whole of the affected 3 countries, what we felt was necessary and what we were prepared to do. And we issued this joint statement. And then people started to notice us, and it was interesting. And we carried on. Membership grew. At one stage, we had over 100 companies. We had 40 public bodies. And on one call, because it was all done by conference call technology, we had 500 people dialing in. And it was all about sharing experience, talking to each other, putting stakeholders under pressure and under scrutiny to find out what more we could do. And by November, December, the United Nations, because if you remember, Ebola was a sort of a global effort to help those 3 countries, were also very interested in what we were doing. And I found myself as the chair of this process, getting sucked into the United Nations sort of General Assembly process, where, so what happened in August, which was just an informal meeting of 11 people, by December, I found myself talking at the, in the guts of the United Nations building in New York, talking to huge audiences and country leaders about what the private sector felt could be done and should be done with Ebola. Then, however, by January 2015, when the curve had bent and it was going down in the right direction, the private sector felt like we now need to just get on and start rebuilding our businesses and getting into recovery, whilst the public sector sort of wanted us to carry on, but we didn't have the infrastructure or the means to carry on. So it was a short, sharp shock of just an instantly mobilized collaboration, which was useful for a few months, had a voice, but then fizzled out because the businesses need to get on with the day job. So there's sort of positives and negatives there. So we started to list what we had done, and I won't read this out for time, but we did do a list of tangible things. People like to know, what was your positive impact? How much did you raise? What did you do? And we started to list it. And I remember when I looked at this list, the numbers weren't as spectacular as I felt they could have been, but that's because we were focusing on the tangibles, and we got ourselves stakeholders who were judging us or were measuring us on things which are measurable. But the real benefit are the things you couldn't actually measure. Was that for that moment when the private sector were nervous, they were anxious, they didn't know what to do, they were worried about their own lives, the lives of their employees, the strength of their business, what we created was a sense of community, a place where by just talking to each other, they calmed down, and that gave them the confidence to be more positive. There were some issues which were very unique to the business community, which were vital to be resolved, like how to manage travel restrictions, what to do with expats, how to build the right level of medical facilities, how much of people travel within country or not. And all of those things that, they could share notes and come up with joint policies and make ask of the government. They felt they were part of a bigger, they were part of a solution of a bigger problem than the company. It took them away from just looking after the company's interests to being part of a mobilized group to make a bigger contribution. The private sector had an identity and it had a voice. Historically, the thing that struck me the most in the early days of this was many NGOs saying, keep out the way, you don't know what you're doing, just give us a really big check. But in the end, what we ended up doing was giving them a bulldozer for 2 weeks to lay foundations on Ebola treatment units, giving them mobile phones, giving them buckets, giving them advice, giving them logistical support, mobilizing trucks just to move things around. And that was easier and quicker than just giving checks. So the relationship became more collaborative and more creative. And as I said, since we reach a lot of people through our employees, again, another intangible benefit. So my argument is actually the greatest contribution of this group were the intangibles rather than the tangibles. And that's why people forget about it, because that's hard to measure and codify. Conscious of time, I won't do that. And then COVID came, and World Economic Forum contacted me to say, could you re-establish that group and to help them fight COVID either in Liberia or a wider region across West Africa. So I said yes. There wasn't the group didn't really exist anymore, but I learned from the model, and so I asked the CEO of our Liberian business and a contact we had in Ghana to start setting up the same model in those countries, with a view of not seeing if we could extend it to the rest of West Africa. So we picked up the phone, we had a conference call, and these were sorts of the issues those 40 people, mainly business leaders, were listing as what was front of mind with them. And so we started developing work plans for this. What could we do together? And so the model really was, let's have groups in Liberia and Ghana. They are to work on what they can do together, where working together can really help. The phrase value propositions emerged, is what extra value can a coalition of the private sector do to this issue? And then let's create working groups to deliver that. We then will get connected with the local government and offer our help or see where they want extra help from us. And then once a fortnight, I just chair a regional call where we just exchange notes for those two countries, but it's open to anybody in West Africa. So again, it's just a situation for people to learn. So we're sort of building a bit of a network here, which replicated what we did with Ebola, with country working groups and a regional platform to sort of coordinate it. So these are sorts of work streams the Liberian group are working on. Notice how testing is bubbling to the surface as an absolute key one. Again, you can have these slides, so for time I won't list it, but very clear, tangible programs where the private sector have working groups or are working together amongst themselves or with the regional governments to make a coordinated, consistent approach on these issues. Similar for Ghana, again, look how testing has bubbled to the surface. That was already mentioned earlier on another thing. The last one's very interesting about how we're getting better at capturing what's being donated, what's being given. But again, this is sort of from the people, for the people, of what needs to happen, but more importantly, what needs to happen, which the private sector can do very well. And you actually see the value of having a regional group to actually sort of share between countries. And the other thing as well, which I've noticed, is both the country groups value being part of a neutral platform which is beyond their country. So there's a little bit of sort of soft people dynamics here about this framework which works. And imagine if this model had, more of the West African countries going into it, just how powerful it would be. But we didn't have the capacity to outreach or grow that model in other West African countries. But I think we've got a format which is adding value at the moment. So what I thought was, crikey, having found myself involved in 3 pandemics, what is the learning? What have I picked up from doing this as a professional CR person, not a doctor, on what can and cannot be done? The first thing is just the left-hand column are the sorts of issues we need to work on as a private sector. There are many more, but just how similar they are, despite the fact that HIV, Ebola, and COVID are very different. So surely we can capture this, and we know what we can do, and we know what we can do well. Can we codify this and sort of find a place to keep it to be ready for the next pandemic? For me, it's all about the country groups. The country groups are absolutely important. The country groups which work when there's a clear business leader in that country who has their own in-house support to help do the job. The language is problem identification and solution finding. Let's just get on and do this. There's no hierarchy, there's no rigid structures. Governance can sometimes stifle these initiatives. Modern technology, Zoom calls, of course, makes things a lot easier. The stronger the connection of that group to local governments and local NGOs, the more effective it will be. It's all about mobilization and collaboration. I say no governance, no business models, no fees. We just get on and do it. And when we're not needed, we slow down. course, you've got to be flexible. There's no one size fits all model. And as I said earlier, this being linked to a larger, more neutral platform beyond the country seems to have added value. The weakest link will always be secretarial support. How do you sustain this? How do you codify it? And that's one of the reasons why I think we don't quite reach the potential we could do. So the observations I'm sort of making is, throughout my career, I've been in, there's been more times when I've been involved in pandemics than not. So clearly, pandemics is part of a CR profession's role and therefore part of a company's role. I wouldn't push the argument that the only way companies can do more is to change them. I think it's more about let companies do what they need to do and then play to their strengths. Good companies are embracing CR and sustainable development. It's getting pandemics as part of that agenda and then play to their strengths. The language is resilience. How can a company be safe from a pandemic, both before, during, and after a pandemic, and through that helping stabilize the economy it operates in? The more coordinated the private sector approach, the greater its contribution. And the models I developed very ad hoc, informally, I think there's a lot of lessons to learn from, be it West Africa, Africa, or even World Economic Forum are talking about even a wider platform. So for me, the two emerging exam questions are how to create and sustain a pandemic resilient company. The weakness is we still kick in when we know there's a risk. We haven't accepted yet that the risk is always there. And how to mobilize a coordinated private sector response so it moves quicker than both the Ebola and COVID did. Both of them came into force when the crisis was happening rather than when we knew the crisis might happen. So we sort of reacted probably a month too late. So the emerging idea I'm sort of talking informally to people is whether or not we can create a sort of a long-term pandemic resilient private sector group, which has three elements. I think there's now a very clear case that every company in the world should have a pandemic readiness plan. And they can do that because it's part of straightforward risk management, crisis management planning. So they know how to do it. They do it on other things like their warehouse burning down. So they should do it on pandemics. In countries such as those countries in West Africa, a business leader or leaders should easily be identified who understands what to do and can mobilize very quickly, and then coordinate his or her network to create a regional platform. A secretariat would help mobilize those people quicker and give them extra support, as were discussions on a continuous basis with experts and medical global networks. And by that I mean having those key individuals, the chairs we currently got, always on call and finding very straightforward ways to brief them so they're ready to rock and roll when one of these pandemics happens. So pretty much that's what it is. So please, please, please don't underestimate the contribution the private sector can do without it changing much. I've shown the contribution they can make by just getting them to talk to each other. I think there's potential to codify and embed that in a more permanent platform. And that's what I need to say. Thank you.
Alan, thank you so much. We really appreciate your contribution and look forward to discussion. Let me just, in thinking of time, I ask, we'll just go directly now to Michael Osterholm. I think he's got a presentation as well. So Mike?
I do.
There we go, perfect. Excellent.
Thank you very much. And I think Alex, you can run the slides for me, is that correct?
That is correct. Just let me know when to
thank you very much.
step.
Okay, well, I want to spend a few minutes today really distinguishing between epidemic and pandemic responses in the private sector, because I think there remains considerable confusion as it relates to what these mean. If I could have the next slide, please. First of all, we have to understand that there is a critical difference between this terminology, and it's more than just terminology. It's also our lack of preparedness or thereabouts. A pandemic is an epidemic occurring over a very wide area, crossing international borders and usually affecting a large number of people. Modes of transmission, agent pathogenicity, and virulence are major determinants in assessing severity. Pathogenicity means the ability to cause disease. Virulence means the ability to cause severe disease. Modes of transmission are obviously those characteristic ones, whether it be respiratory transmission, etc. Since 1980, the last 40 years, there's only been 3 real pandemics in the world that we've seen: HIV, H1N1 influenza in 2009, and now the COVID-19. An epidemic, in contrast to a pandemic, is the occurrence in a community or region of cases of illness clearly in excess of normal expectancy. The number of cases indicating the presence of an epidemic varies according to the agent, size of the outbreak, and the type of population exposed. This would include, in many instances, regional outbreaks that are of real importance. And I have called those often agents of regional importance. They're very different than a pandemic. And we have to understand that because the implications for what might happen, how we respond, are all linked to these two different concepts. Next slide. If one looks at the respiratory pathogen-associated pandemics, which we are sitting now today emerged in a very serious one, influenza has been by far the Lion King respiratory pathogen over history. There have been at least 10 pandemics in the last 257 years that we can document, 8 well-described. Onset can occur at any time. Of the 10 pandemics, 2 started in the North American winter, 3 in the spring, 2 in the summer, and 3 in the fall. And in each instance, there was a first initial wave lasting anywhere from 2 to 4 months, for which, despite a lack of any human intervention of any kind, no mitigation strategies, we saw cases, in a sense, disappear. A major trough occurs with an absence of cases, and then a classic second wave. With at least 9 of these 10 pandemics, that's exactly what happened. H1N1 in 2009 was a good example of that, with the initial spring, that first peak occurring in the March, April into early May period, with a relatively quiet summer, and then in late August, reemergence with the peak of the curve occurring in the first week of October, and then quickly dropping in incidence after that, even before vaccine had any impact. Of course, we're now in a coronavirus-associated pandemic. I just wanted to note that SARS and MERS do not currently have the biologic potential to cause a pandemic. They are surely diseases of critical regional importance, but because of the transmission characteristics being much later in the clinical course of illness, we know how to stop these. We have eliminated SARS. As such, MERS continues to be a problem because nobody's going to put down 1.7 million camels on the Arabian Peninsula to stop that, but we've been largely able to stop human-to-human transmission. Of course, now we are in a pandemic that has all the markings of being a pandemic for the ages. I would just very soberly say our great-grandchildren will be studying 2020, just as we have studied 1918. Next slide. I wanted to go back, there you go, right, that one right there. This slide I wanted to show intentionally. It's an old slide. It's 20 years old. But I actually first saw this slide at a National Academy of Medicine, Institute of Medicine at that time meeting. And it was a slide depicting how the world had changed. If you look at the days to circumnavigate the globe 160 years ago, 170 years ago, we actually took over a year with fast sailing vessels to get around the world. By the 1950s, with the advent of the jet engine, that changed. What I will show you in this slide is that the actual what happened between 1950 and 2000 with days to circumnavigate the globe is by far the most dynamic part of this line, even though it looks flat. Today, we know world population has grown from 2000 at 6.5 billion to now over 8 billion people. Next slide. This is the important message to send home to you, that today we live in a global just-in-time economy with just-in-time production, manufacturing around the world. This is a slide I took from earlier this morning. Every hour on the hour, all 63,000 fast sailing vessels in the world, which is where the warehouse of the world exists today, is moving goods from around the world to other locations. Today, a fast sailing vessel leaving the port outside of Beijing will take 9 days to get to the port of Long Beach in California. They will be in port for a period of about 20 hours. They will unload, reload, refuel, and they're back out on the ocean again. Today, this is what we have to understand the impact that a pandemic can have versus an epidemic. Next slide. This is one of those fast sailing vessels in the next slide. Oh, sorry.
Sorry, my apologies.
No
the
problem.
Computer just crashed on me. One second, sorry.
Sure, no problem. This happens to be a very visual slide, so I appreciate getting it back up. Thanks, Alex. So what I want.
Thank you for your patience.
No, listen, You're doing a lot better job driving than I ever would, so thank you.
I'm sorry, it's gonna be a minute. It completely shut off.
Okay, sorry. I couldn't share. Well, what I was about to show you was one of the fast sailing ocean vessels that now traverses the world oceans. It brings us all these different goods that we count on so much. This has been a phenomenon that's changed dramatically in the last 20 years. And in fact, when we were dealing with SARS in 2003 with China, we didn't have nearly the same concerns about this global just-in-time economy manufacturing process. The ship I'm about to show you here, which is now the standard for what we see occurring on the oceans, is, here we go. There you go. You can just go to the ship, okay? Thank you. Next slide. This particular ship here is what I'm talking about. You can go back one. Thanks. To give you some sense of size and capability, this ship is where the warehouse of the goods that we often use and need in this country occur. We are able to put 1 million washing machines on this ship arriving from Seoul, Korea to the United States. 1 million washing machines. Now imagine all the other goods that occur. Next slide. So I just want to use as an example why today we are so dependent on a global just-in-time delivery system and manufacturing around the world, and why a pandemic can cause such a disruption. This is a project that we're involved with, and it's just one example of what happens on a global basis with a true pandemic as opposed to a regional epidemic. This is the CIDRAP Resilient Drug Supply Project. We focus on supply chains and global distributions for the most critical drugs for life-saving and life-sustaining treatment. The purpose of this effort is to improve the healthcare supply system's ability to maintain a steady and adequate supply of critical medicines and supplies. It's funded by the Walton Family Foundation. Next slide. In a sense, the overview, our project is developing a detailed mapping of the entire supply chain for U.S. drug products, which does not exist in any regulatory or private agency or company at this point. This drug supply chain map includes production and movement of products from raw chemicals, including active ingredients, to active pharmaceutical ingredients themselves, APIs, to finished dosage form, to the FDA approved product NDA, ANDA, or BLAs, to actively market a drug product in the United States at the national drug code level, to actually distributed product in the US supply chains, which can be very complicated, from wholesalers, retailers, and providers, and then the product to be administered to the patients in need. There is no system in the world that does this right now. The closest we deal with is in New Zealand. The government of New Zealand, the MedSafe program, has worked on this issue. We are partnering with them in our project here with this. Next slide. This begins to give you some sense of this. We actually brought together a group of experts in medical treatment more than a year and a half ago. And in this case, we defined critical acute drugs are drugs that, when medically needed in acute care, must be available and used within hours or days, or the need or the patient will suffer serious outcomes that may include disability or death. Also, the absence of a critical acute drug, or even the lack of availability of an effective substitute, may also lead to serious health outcomes or limited ability to provide humane care. In this process of bringing together these world experts in medical care treatment, we identified 156 drugs that are critical acute drugs used in the United States today. All are generic drugs, and for which 63 were in shortage status before the COVID-19 pandemic hit. Next slide. This is a slide giving you a sense of the increase. I don't have 2019 on here, but as you saw, that was 63 drugs. You can see how we increased in 2008, where we had at that time 1 drug. And today, in 2019, we are over 63 drugs. And what's happening with COVID, that number is increasing substantially. This is a real concern as it relates to trying to provide routine medical care in this country and countries around the world, whether you're a high, medium, or low income country. Next slide. To bring this home more specifically, we are still working on the drug supply chain for the whole critical drug list, but we've also concentrated over the course of the past 4 months on COVID-related drugs. For 18 of the 21 critical antibiotics, all generics, that may be used to treat secondary infections due to COVID-19, a real issue and concern, the U.S. drug supply depends heavily on foreign sources. For these 18 antibiotics, more than 80% of the drugs, which are identified by the National Drug Code, are marketed in the United States, are either made in China, India, and or Italy, of which even in Italy, a number of the APIs come from China and India. I might note that Italy had the unfortunate situation of also placing their drug manufacturing capability for antibiotics in the Lombardy region of Italy, which, as you know, was also hit severely by COVID earlier this year. We have a real challenge here. Right now, we are literally on a day-to-day basis seeing shortages trying to be met by beg, borrowing, and stealing these drugs. Next slide. So I just wanted to share with you to understand the impact of a pandemic, in particular one caused by a virulent and readily transmitted respiratory pathogen on global marketing or manufacturing and supply chains is like any other event. A war hasn't done this. We've seen no economic downturn that has done this. The world has become heavily dependent, particularly in China and India, but also other limited areas of the world. And when a pandemic hits, unlike an outbreak of regional concern, you can literally bring the world to its knees. You heard Peter Sand talk earlier about things like PPE. I can go through a laundry list of critical elements of products and supplies that right now have been seriously challenged by the presence of this pandemic that have never occurred with regional outbreaks of infectious diseases. So I just want to point out that when you prepare for an epidemic, it means nothing about how well prepared you are for a pandemic and what it means. Unless that epidemic is occurring specifically in one region of the world where this production occurs, which then could have an influence on that limited production area, you're not prepared. A pandemic presents challenges that global governance and business resiliency plans are not prepared to respond to and navigate in a timely way. Many critical products and services are jeopardized. Today, I think if anything, the business community has now realized is the critical nature of supply chains and where they originate from and the impact that a pandemic can have. Trade wars, as I said, other economic considerations, war, none of these have had the impact that COVID-19 has had. And it's just an example of why we can't be lulled into some sense of security that because we can handle an epidemic, we can handle a pandemic when it comes to the world. Thank you very much.
Michael, thank you very much. And Alan, too. I apologize, I'm not going to be able to have my video come on, but as I told you, that I think our two speakers really did illustrate the point I tried to make at the beginning, which was there are things we can learn from the past if we're sharp and we look at that. But as Michael rightfully pointed out, we're facing a very different situation than the epidemics and more narrowly targeted geographic events. So let me actually ask you all a question. I'm going to invite the forum members to raise their hand if they want to ask questions. But I really want to just build right off where Michael left off. The question is, I think you made the point this is an unprecedented event in so many ways. It affects our supply chains, private companies in very different ways than even the tragic events in Ebola in West Africa. But so Michael, I maybe invite you and Alan to comment on, if that's true, what do we need to do? What steps could be taken right now? What looking from a private sector perspective, what do you want to see companies do to recognize the global nature of this? Or is this really a time where government needs to respond, or both? And I guess I'd ask Michael to comment, like, what do we do with that observation? And then ask Alan to reflect, if that's okay.
Well, let me just add context to this. When we look at the drug supply issue, just as one issue, the Department of Defense in the United States is as vulnerable to these drug shortages as any other institutional setting we have. Now, imagine if we outsourced our munitions production to China. Would anyone find that to be an acceptable approach to dealing with securing critical products or services? I don't think so. And yet, today, we have a number of critical products manufactured offshore in many places in the world where a pandemic literally can shut down this. I mean, the ports of China have suffered immeasurably over the pandemic and the inability to move these ships, as I just talked about. And so I think that what we have to do is look at business today. And I can tell you the EU is looking very closely. We've actually been working with EU representatives to say, wait a minute, we need to understand what have we done in concentrating manufacturing in certain parts of the world and made us so vulnerable to little or any redundancy. And on top of that, contingency plans for if certain areas go down, can we continue our supply chains? A good example, I mean, and I just use this as an illustration, you can make the best car in the world. You know, everything about it's amazing, but if you're short steering wheels, you know, you don't sell too many of them. And people have not really appreciated and understood the necessary issues around securing supply chains and decentralizing some of the concentrated manufacturing and shipping because of a pandemic. People haven't thought about that. I mean, as we go forward, and I believe that this pandemic is going to get a lot worse, not a lot better. I think the security issues around the drug supply, the number of collateral damage outcomes that could occur just because of that alone could be substantial. And I think that's PPE has clearly been that way already for healthcare workers. So I just think we have to rethink the approach, and the private sector in their own best interest to consider this and how they're going to deal with it.
Thank you, Michael. Alan, do you want to reflect on that too?
Yeah, I mean, for me, it's the scale of the challenge being posed, because what you're saying is we need a new economic model. You know, we've invested heavily in a globalization trade model. I accept the risks with that. And I know many companies are already thinking about how much do they repatriate closer to them. But to really get that into a place which is really effective for everything like washing machines, it's a fundamental change in every single country's economic strategy. That's a massive debate, which, you know, you need to take to the core of World Economic Forum and politics, but I think it's a valid proposition. However, I would change the nuance slightly. It's not just about the trade in, you know, washing machines and those container ships. It's actually the movement of people around the world. So is this event the new future? Because 12 months ago, I imagine we were all thinking we were going to meet in Washington to have this meeting. Yeah. Right. So is it us as individuals, you know, I don't want to come across as sarcastic, but, you know, you don't catch COVID from a washing machine imported from China. You catch COVID from somebody who's come from China and moved to another country. So it's the person you catch it from. So what we're really talking about is the end of global travel for us as professionals, as much as the private sector who move goods around the world. And I'm up for that. You know, I think, you know, there's a lot of people who are reflecting on just how easy it is to do events like this and have meetings in a global company on Zoom than travel. But it's travel of individuals, be them on ships importing washing machines or holiday makers or conference delegates who are spreading this disease around the world, not global trade, global movement of people.
Yeah,
So,
if I could just respond to that, because I think there's some confusion and I want to be sure my message is clear. I'm not suggesting that human travel is not important, but human travel has nothing to do with global supply chains of critical items that we need. And I'm sorry if I used washing machines, it's just as when people can visualize 1 million of them on one ship. Those same ships are containing critical antibiotics, all the drugs I mentioned. They're containing much of the kind of products that we count on every day to save lives or to run our businesses. That's where the impact is. We don't realize that a house on fire in India is just as critical to us as a house on fire in the United States, because if in the end, the drugs that we need that house makes, and we can't have them anymore, and we've become so dependent. I mean, look at just the antibiotic sourcing I just gave you. Most people would be shocked to realize that we don't make antibiotics here anymore, and we are dependent on the rest of the world to make them. And there are very limited places in the world that make them. And so we have to understand the secondary impact of a pandemic, that without a political intent, without any kind of economic disruption, we can literally bring the world to its knees. That was not even a situation, as I said, in 2003 with SARS. I worked a lot on SARS because we had not centralized manufacturing. We had not centralized the just-in-time supply chain. It's all been a product of the last 20 years. That's what I think today we have a new vulnerability that very few people realize that a pandemic represents.
Let me, I'm looking at our time, but I'm also trying to combine a couple questions from the Q&A and the chat room. Scott Ratson raises a question that's very similar to one that came in the Q&A, and I'll, with taking liberty, and I hope I don't miss any of the nuance, but basically Scott and one of the people in the public have said, all this is true. We've had how many people on this Zoom call been in meetings over the last 10 or 15 years where projections are made about the potential for a pandemic, various risks. I mean, maybe not in every level of detail that we're seeing now. Is this, as you guys think about this, have we just failed to plan? And is this, does that mean, if so, does that mean we can only innovate in a crisis like this? Or I guess just some reflections on, we've clearly been aware, at least among some people, that there's this crisis, but how do we learn now in real time? Because maybe that's the only moment we have to innovate the way we need to. So just make a couple final thoughts along those lines, because then we'll need to transition. Alan or Michael?
Go ahead, Alan, if you want to start.
You definitely can innovate faster in the crisis. It's amazing the things the company I work for to make PPE, you know, in all the plants we have around the world. And we didn't know we could do that until we had to. And maybe in that sort of innovation is the solution you're looking for, Michael, about, you know, how do we actually use the private sector or public money to actually have manufacturing and storage facilities for everything we require close to home, close to every single place in the world. I think that's a very valid provocation, which we should take absolutely seriously. Because of the work I presented we're doing in West Africa on COVID, it's where do we get the testing kits from, where do we get the PP? And those countries are quite small buyers in, you know, trying to get their share of what's coming out of China. So I experienced firsthand the exact problem you were describing. But yeah, businesses can innovate quickly in a crisis because they've got the motivation, but they've got the brain power to innovate whenever they're asked to. So there's something in that bubble of thinking.
Right. You know, I think it's not a good time to plan a vacation when you're in the middle of having a heart attack. So I would suggest that, you know, it's one of those things where I don't expect that we're going to see real change right now, although there has had to be a lot of innovation to just address some of the supply chain shortages. But we do have to have enough institutional memory that when, in a sense, this is over with, that we do the kind of hot wash that's necessary. And, you know, I think one of our challenges has been we have just lacked creative imagination. You know, I'm not a real smart guy. I'm just a small Iowa farm town kid, okay? I wrote a book in 2017 where I laid out this pandemic is exactly as it's unfolding. The economy, sports, hospitalization, waves, you know, cases. So it's not like we couldn't have thought about this. We just elected not to think about it. And I think now is the time that we have to understand we have proof here that this is happening. And I think that we are going to change. Alan, let me just say, I spent the first 3 hours of my morning before here on a WHO call, which there were people from 12 different countries on it. When I get done here with this one, I'm heading to another one that includes a number of partners in 4 other different locations in the world. We've changed, but what we haven't changed is yet where we're making products. And we're just as vulnerable today as we were. So we may change transportation and movement of people, but if we don't understand the vulnerability of these goods, we're still going to be in big trouble.
Let me thank our 2 guests, Michael and Alan. I think they set the baseline that we had really hoped for the remainder of the discussion. And if we could do a Zoom applause, we would. I think. But I do want to thank everybody for their time, and I'm subject to being corrected by Lisa. Let me just set up what our next steps are. We're going to take a 10-minute break, which means that we're going to reconvene, I guess, closer to 12:25. Is that right, Lisa? Or so?
12:20, yes.
12:20, I'm sorry. So it's even a shorter break. So we'll reconvene at 12:20. We have a terrific panel that's gonna, looks across a range of opportunities for PPP and private sector responses in country settings with a focus on COVID-19. And so our speakers include Dr. Alad Assi, the former Secretary General of the International Federation of the Red Cross, and now currently the chair of the Kofi Annan Foundation. Brenda Calatrella, who is the Associate Vice President of Corporate Responsibility at Merck and a member of our forum. Trevor Gunn, who is Vice President of International Relations at Medtronic. And Victoria Weldon, who is the Global Medical Director at ExxonMobil. The session will be moderated by Allison Goldberg, who is the Executive Director of the AB InBev Foundation. So this is bio break time for everybody. The group will reconvene and Allison will get us started at 12:20. Thanks again to our speakers. Great start to the day.
Thank you.
Lisa?
Okay, I think that the break has ended. I know it was a short break, but as John had said, I think that we're first going to hand it over to one of the co-chairs to open up the panel.
Oh, good morning. Hello, this is Clarion Johnson, and I will open up the panel. The next section will involve the challenges and opportunities of public-private partnerships and private sector responses to COVID in country settings. The speakers of this session include Elijah Asai, who is former Secretary General of the International Federation of Red Cross and chair of the Kofi Annan Foundation, Brenda Colatrella, who is Associate Vice President of Corporate Responsibility at Merck & Company, Trevor Gunn, who is Vice President of International Relationships at Medtronic, and Victoria Weldon will be replaced by Dr. Malik Diarra, who is Head of Public Health, as well as a Senior Manager in the Department of Epidemiology and Public Health and Medicine, as well as Industrial Hygiene at ExxonMobil. This session will be moderated by Allison Goldberg, who is Executive Director of Albev Foundation, and we're ready.
Great. Great. So thank you, Clarion. So as Clarion pointed out, that we have a terrific panel that's planned today. And Dr. Assi is going to kick off that presentation. How it will be structured, similar to the other session, is that each panelist will have about 15 minutes to present. And then we will open up questions to forum members and then the public. So looking forward to a rich and diverse discussion. Dr. Assi, it's over to you.
He is unmuted.
Yes, we can hear you.
Dr. Assi, can you unmute yourself, sir, please?
He is currently unmuted. Not sure if he's checked his connectivity.
Okay. Might I suggest giving him another 10 to 20 seconds? If not, we will proceed with Brenda.
Brenda, you have share screen ability if you would like to go ahead and take it.
Thank you, Brenda. Oh my goodness, that's beautiful.
It's beautiful when it works.
That's right.
It's not so beautiful when it doesn't work. Good morning, good afternoon, everyone. Thanks for inviting me to be part of this panel. And hopefully the technology will cooperate. But you know, when I was preparing for this conversation, the one thing that struck me was just how vast and all-encompassing this pandemic has been, both in terms of its impact, as well as the needed collective response. So just trying to get my head around how best to convey Merck's response was challenging, and hopefully I'll be able to give you a flavor for the broad approach we've taken and the role of a healthcare company like Merck in this crisis, with a focus on some of the efforts that are most relevant to today's workshop. So our response to COVID-19 is focused on 4 major priorities. First, we've taken a number of measures to protect our employees. Most of our staff is working remote for national travel. We're providing resources to assist with both physical and emotional well-being of our employees and their families. One of the most important things we do as a company, along with our research, is ensuring a continuous supply of medicines and vaccines for our patients. We have extensive plans in place to maintain continuity of supply and to support patients in clinical trials. We continue to thoroughly assess our supply chain demand and potential impact, And as a result of these efforts, we have not seen a near-term impact on production, supply, or distribution of our medicines and vaccines due to COVID. And in fact, we have been able to, so far, maintain normal supply levels. As a research-based healthcare company, the discovery and development of innovative medicines and vaccines is frankly what we do. So we're involved in several research-focused partnerships to discover and develop antiviral therapeutics as well as a vaccine. And finally, we are engaged in several efforts to actively support communities globally. Given the focus of today's workshop and this panel, I'm going to focus on those last two components more fully. I think we all recognize, and we've heard from the previous speakers, that the COVID-19 pandemic is the scientific and global health challenge of our generation, and demands partnership and collaboration from across the scientific community. As one of the very few companies that has continued to invest in both vaccines and anti-infective medicines, we know we have a special responsibility to help advance vaccine and antiviral efforts as part of our overall response. So we've been fully committed to developing an effective response since the pandemic began. Merck has been engaged in its own research as well as discussions with others to contribute our scientific expertise in finding solutions to COVID-19. Because we know that from experience that the path to a vaccine is difficult, we have been carefully evaluating different platforms to select vaccines and platforms with desirable qualities, such as the potential to be a single-dose vaccine. We thought it was really important, particularly in the early days, to take a very thoughtful approach and to use our resources to pursue the most promising solutions. Due to the obvious urgent need, research and development related to COVID has quickly become a top priority for Merck, and we are investing appropriately. I think the good news is that we have the expertise and capabilities to advance multiple development programs for COVID, while at the same time continuing to advance our own research priorities to address continued threats from other diseases. For COVID, we've entered into a number of collaborative efforts. I'm not going to go into any great detail here, but just wanted to name a few of these collaborations quickly. So we're working with the International AIDS Vaccine Initiative, or IAVI, to develop an investigational vaccine against SARS-CoV-2. Recently, we acquired a company called Academies, and we'll work together with them to accelerate the development of their SARS-CoV-2 vaccine candidate. We've entered into a collaborative agreement with Ridgeback Bio to develop a novel orally available antiviral candidate currently in early clinical development for the treatment of COVID-19. Earlier, we heard Dr. Zhao mention both active and ACT accelerator partnerships, and we're also actively involved in this. And we're also participating in the Gates Foundation CEO Global Health Roundtable initiative, which is focused on areas of potential collaboration between industry and the foundation in response to COVID-19, as well as possible future pandemics. So again, these are just some of the engagements that we are involved with. You know, we're optimistic that such unprecedented collaboration across all sectors will develop the new tools that are needed to address the pandemic. We are also committed to ensuring global access to a SARS-CoV-2 vaccine or medicine we develop. As both our CEO and our head of research have reminded us, we recognize that no one is safe until everyone is safe. And I think this pandemic also underscored for Merck the need for us to continue to invest in research for the greatest health threats. So in addition to our research efforts and collaborations, we're also doing our part to support communities in a number of ways, having contributed or committed more than $30 million to support COVID-19 relief efforts so far. Our contributions have been wide-ranging, both in terms of what we are donating, how we are donating, where we are donating. This has really been a global effort in terms of involvement of Merck people, and as well as the reach of our efforts. We have contributed from and within the US, but also through many of our subsidiaries around the world. The response to the pandemic has had a level of engagement, both internally and externally, and a reach that goes far beyond responses to other type of crises, at least in my experience. So it's been pretty broad and pretty vast. In terms of our funding, for the most part, it's intended to support immediate relief efforts, as well as future capacity building and health systems strengthening. And we also chose to focus on people and communities who have been disproportionately impacted, both in the US and globally. In terms of our support, as I mentioned, it's been pretty diverse. It ranges from donations of medicines and vaccines to PPE and medical and laboratory supplies, anything from masks, Tyvek suits, goggles, gloves, just a wide range of medical supplies and equipment, as well as funding to a number of relief organizations. And again, I'm not going to go into a lot of detail here, but I'll just mention a few of the organizations that we have been supporting. The United Nations Foundation's COVID-19 Solidarity Response Fund in support of WHO. We are also supporting the CDC Foundation's Emergency Response Fund. And we've also provided support to the US Chamber of Commerce Small Business Fund. And then I'll just mention two other programs that are actually ex-US. Through an existing partnership with Project ECHO in India and Vietnam, our support in both countries through Project ECHO has helped position the ECHO programs there for a robust response to COVID-19, and particularly in training providers and public health professionals in responding to COVID. We are actually now exploring an expansion of our partnership to support COVID-19 preparedness and response in sub-Saharan Africa. In addition, because of the wide geographical impact of COVID-19, we established a regional grants program to enable our subsidiaries across the regions to support the efforts of local organizations and entities and provide much needed support in local communities. Finally, our employees have stepped up in a big way, donating to various relief organizations, including the CDC Foundation's Emergency Response Fund, and with a match from the company, have contributed over $1 million, and that number is still growing. I also wanted to just mention one new innovative program that we developed in direct response to the pandemic, which is called our Global Medical Volunteers Program. Recognizing early on the need for additional healthcare professionals, including doctors, nurses, and medical laboratory technicians to assist, particularly in regions where COVID was spreading very rapidly, we announced a new global volunteer program to enable our medically trained employees to volunteer their time to aid their communities while maintaining their Merck base pay. This is a program that normally would have taken months to sort out and establish, and miraculously it was actually pulled together in a matter of just a few days. So our volunteer employees were able to provide boots on the ground, working with hospitals and health facilities to help provide much needed relief to overburdened facilities. And approximately 100 of our employees answered that call, including a mix of nurses, MDs, medical technicians, pharmacists, health counselors, and others. To date, our employees have recorded more than 680 hours to support our COVID response, and we suspect that number is actually much higher because this is what folks have recorded, and it's always a challenge to get people to go back in and record their hours. So I also wanted to just pivot a little bit here and touch on how this pandemic has not only called on us to create new programs and partnerships to address COVID specifically, but it's also called on us to modify existing PPPs that were indirectly impacted. With COVID-19 rapidly spreading globally, WHO understandably recommended a halt to mass treatment programs for neglected tropical diseases, including our 33-year-old Mectizan donation program that is focused on the elimination of two neglected diseases, river blindness or onchocerciasis and lymphatic filariasis. With the prospect of potentially losing months, if not years of treatment, and the potential detrimental impact that might have on the interruption of disease transmission, we knew pretty quickly that we needed to assess the situation with our partners, both internally and externally. So in consultation with a number of stakeholders, we decided that we would continue to ship Mectizan to countries so that it is immediately available and ready as soon as the distribution programs are able to resume. We work closely with our manufacturing and distribution teams, as well as our partners in country, to ensure their ability to receive and properly store Mectizan. In addition, we consulted with public health experts and disease modelers to understand the impacts of stopped treatment with a range of scenario planning to mitigate the potential long-term impacts on communities and the elimination of these diseases. So there was a lot that needed to be done. I mean, this is a program that's been in existence now for 33 years, but COVID even managed to touch it and result in our having to take a hard look at it, reevaluate it, and make some changes. I know there has also been some information in the public domain recently related to the use of ivermectin or Mectizan in treating COVID, and I just wanted to address that up front. First of all, I think it's important to point out that at Merck, our approach is always evidence-based and one that follows the science. We are very focused on taking the necessary steps to ensure safety of any existing or new antiviral or vaccine, whether we're in normal times or in a pandemic. So with that, both Merck and the Mectizan Expert Committee, which is a group of experts about the appropriate use of Mectizan, concluded that based on the concentrations of ivermectin,
Hey, Brenda, sorry, you're actually
antiviral
cutting out right
effect
now.
in vitro, the magnificent, oh, sorry.
Do you mind starting over from this slide? Sorry.
Oh, no, that's fine. Sorry about that. Not sure what happened. Can you hear me now?
Loud and clear.
Okay. So let me just go back a little bit. What I was saying was that I know that there has also been some information in the public domain about the use of ivermectin in treating COVID. And I just wanted to address that because I know we've gotten several inquiries about it. I think first and foremost, we want to make it clear that at Merck, our approach is always evidence-based and one that follows the science. We are very focused on taking all necessary steps to ensure safety, and that applies to any existing or new therapeutic or vaccine. And that's the case whether we're in normal times or in the midst of a pandemic. I think that's very important to note. With that in mind, both Merck and the Mectizan Expert Committee, which is a group of experts that we've convened, they're experts in tropical diseases and public health that help us make determinations about the appropriate use of Mectizan. We both concluded that based on the concentrations of ivermectin that were shown to achieve an antiviral effect in vitro, that the amount of ivermectin that would be needed to reach similar exposures in people would significantly exceed doses known to be safe and well tolerated. And we're talking about on the order of 100 times above the currently approved dose. So as you can see from this statement on the slide that the Mectizan Expert Committee issued, the committee does not believe the evidence supports the use of ivermectin or Mectizan in COVID-19, and we are not pursuing any Merck-led studies with potential treatment for COVID-19. I think it's important because this example highlights the inherent tension between a sense of urgency, which I think we can all understand, but the overriding need for scientific rigor. I think it also highlights the dangers in the use of proposed medical solutions that have not yet been fully proven. And just yesterday, I was reading in the news that people in Peru's Amazon area were actually being injected with the animal formulation of ivermectin, and noting that ivermectin for animals should never be used as a replacement for ivermectin in humans. And as a result of this, they had many people suffering terrible side effects. PAHO just recently, in accordance with its position on the use of medicines without scientific evidence of their benefit for COVID, has now advised against using ivermectin for any purpose different than those for which it is authorized. And we were very pleased to see that statement come out. So just very quickly, we've talked a little bit about this so far in the workshop, and I think the prior speakers did an excellent job of highlighting the challenges. I think we all realize that in addition to the usual inherent challenges in partnership, and we know that partnership is always challenging, pandemics do present some unique challenges for global health response and partnerships. Personally, I think that the fact that this pandemic has impacted every single one of us is unique in and of itself. Many times when we're forming PPPs to address an issue, we ourselves are not directly impacted, and that just was not the case here. So while we're trying to create partnerships and solutions to assist others and address the impact of this on the broader ecosystem, we're also trying to maintain our own organization's business continuity. So that just makes everything more challenging. Just very quickly, there's obviously urgency and a great deal of complexity given the wide scope and impact. The demand for resources is vast, and it's not isolated in this situation to one population or one geography. There's a great diversity in terms of preparedness, resources, and capacity to respond. So an approach in one country might likely not be the right approach in another. And obviously there's an exceptionally high level of engagement required, both internally and externally. And then there's one aspect that I wanted to touch on. I refer to it here as unhelpful approaches or collaboration, for lack of a better term. But I just wanted to point out that, something that I've personally observed. In a crisis situation, people often have a need to want to do something, anything, to help and to help themselves feel relevant. And, this is human nature, and it often and most times comes from a very good place. However, this can also lead to a tendency to create duplicative efforts, rather than joining or adding to existing work, sometimes in order to preserve an individual organization's agenda and leadership, new parallel activities are created. And I think this could be incredibly challenging and time-consuming for partners and organizations to navigate, and unfortunately often waste valuable resources. So I think that's something that we're seeing a little bit of here, and something we certainly need to be on the lookout for and try to avoid. In thinking about lessons learned and what is or should not be transferable, obviously there's a number of lessons and characteristics of our collective COVID-19 response that are certainly useful instruction for the next pandemic. But in some ways, I feel we are still in active mode with our COVID response, and not yet fully in what I would call reflective mode. So very, very briefly, I just wanted to highlight our previous experience with Ebola and the development of our VIVO, our vaccine for Ebola, because this was really instructive for Merck in formulating our approach to COVID-19. And again, I'm not going to go into a lot of detail here because of time, but also because I want to point out there's a really good article that was published in Nature this month. So if folks are interested to learn more about our experience with the development of our VIVO for Ebola, I would encourage you to take a look at that. So I already mentioned, the types of complexity inherent in global epidemics and the need for novel approaches. I think our experience with Ebola also showed us the challenge in enabling speed without sacrificing quality and safety. And it clearly demonstrated the importance of continued partnership and innovation, particularly, and I think one of the speakers pointed to this earlier, leveraging the expertise of different organizations that can accelerate solutions, particularly in areas where you do not yourself have that expertise. But I also think we have to recognize that this also requires shared purpose, cooperation, and oftentimes compromise. Lastly, and perhaps most important, our experience with Ebola highlighted the central and critical role of impacted communities. These are communities that serve as innovators, ambassadors, and enablers to identify needs, overcome barriers, and really help by creating clear and effective channels of communication and helping to create trust between the private sector, community leaders, governments, and everyone involved in the response. And then finally, when we look at this overall, or when I step back and look at it overall, there are a number of things that came to mind in terms of what is transferable here. And again, I'll be brief. I think first and foremost, and again, we've heard this, preparedness is key. I think we need to work with and support governments and organizations to ensure that strong health policies, practices, and response capacity are in place ahead of an epidemic or pandemic. We need to keep our own employees safe and our business going, because that's the only thing that's going to allow us in the midst of a pandemic to pivot and turn our attention to the larger ecosystem. Never before has engagement, collaboration, partnership with a wide array of partners been more critical. I don't think anyone can dispute that. but thoughtful partnership that avoids duplication, misalignment, non-optimal use of resources should be the goal. We've talked about innovative thinking and action. We've talked about the need for diverse and customized responses, and I think we're all seeing that. Actions that facilitate speed or acceleration are also important, but with appropriate focus on caution. And we can't emphasize enough the importance of safety, particularly when we're talking about medical solutions. Yes, there is an urgency here, but not at the expense of safety. I think we have to recognize that there are no shortcuts and none should be taken. Distinguishing between what requires a short-term solution versus a long-term solution, I think is important. It goes without saying that working at and building capacity at the local level is also critical. And finally, last but certainly not least, and as we saw with Ebola, fostering and leveraging and committed communities can really make the difference between success and failure. So, just in conclusion, I think it will be important to capture lessons more fully as our response continues and time goes on, as these lessons will certainly be helpful in informing what will inevitably and unfortunately be future pandemics. So I will stop there and thank you for your time and for listening.
Great. Thank you, Brenda. It was a great presentation, incredibly insightful. So I think Dr. Assi has now joined us, and so we'd like to hand it over to you for your presentation.
Thank you. Thank you very much, and good afternoon to all of you, colleagues and friends. I was listening into the first part and the excellent presentations that were made by the colleagues who touched on, if not all, I would say most of the important issues that I wanted to highlight. So mine was going to be then relatively short, just to point out, to some of the issues that I think are very relevant as far as public-private partnerships are concerned in times of COVID, but of course beyond. So we heard from the earlier presenters that partnership is a joint commitment for problem solving. I would add that it is a long-term accompaniment for mutually beneficial outcomes. And it's indeed about mutual benefits. We should always look at it in that way. So that two-way street of partnership that we all contribute and then gain at the same time is very critical. But at the center of all of that is trust. Trust is about delivering on promises we made if we partner. So trust is, however, extremely difficult to build in the middle of a crisis, in the middle of a shock. And COVID-19, of course, is a shock, it's a hazard. And if those who were able to be there before and are there during and will be there after, will be really, those ones, that will be able to cultivate and then nurture, strengthen, and sustain the real partnerships, that we would like to see. So that would push us to get out of what we called in our report in the GPMB, out of the cycle of panic and neglect, that we all rush into a place, to partner on an issue because it is a big shock. And when it recedes, then we all disappear until next time around. And then we almost, start from scratch again. So the question is always, when we come in, and then by the time we leave, what did we leave behind in terms of, the partnerships, in terms of the trust that we have built, so that next time around, we will not have to start, from, the same low baseline, but we will have to be building a base upon which, we can build on very quickly and communicate this sense of urgency, which is required, to work in difficult circumstances, particularly, at times, of pandemics. So a shock and a hazard is always a revealer. It's a revealer of strengths. It's a revealer of weaknesses. It is a revealer of all sort of dysfunctionalities that we have in our systems. It is a revealer of the relationships, that exist between the governments, and their people. It reveals also the kind of a partnership, that exists or does not exist, among the, different actors that would matter. So in, such a context, in very difficult, circumstances. So if we come back to COVID, I heard very good examples, of good partnerships, and Victor Zhao mentioned some of them. So Peter Sun did so. Peter from the African CDC, I was just listening to what Mark, was doing, and many of these other excellent presentations, that colleagues made before. Those are all good and great. But I regret to say that I saw during the COVID more competition than solidarity. I saw during COVID, indeed, more inward looking, rather than, true partnering and through partnership. So first of all, countries were competing fiercely, among themselves, forgetting that in a pandemic, really, none of us is safe until we all are, and that we are only as strong as our weakest link. We're competing for simple protective gears such as masks, PPEs, and even sometimes, on tarmacs or on the global market, coming up with this higher prices, to be served first. We're seeing already a competition for even commodities that do not exist yet. So bilateral deals are being struck, in the sense of who first will be getting the next vaccine, and we don't even know if we'll get any, and when that will be. The same could be applied, to the therapeutics. So who will be left behind there? Of course, that are those, that have fewer resources, those that will be counting on true partnership, and then those where, unfortunately, if things, continue to develop the way it is, that where we will be finding, the biggest number of cases and then the highest incidence that will not only threaten, those places, but, the humanity, as wholes. So COVID revealed that many countries in the global south had no tests when tests were needed. They hardly had any PPEs. And in some countries with 15 to 20 million people, you could count with the fingers of two hands the number of respirators that were existing in those countries. Well, then you ask yourself, where were the PPEs before that? Now that we're rushing, somewhere to organize, flights, to give, some protective gears here and there, some masks here and there, some respirators. That's all very much appreciated. But what does it really mean in terms of, first of all, governance, by the governments, of those countries, accountability of those governments, to their people, the level of caring, of those, governments, to the challenges, that the people are facing. So where were we? What kind of a partnerships, did we have, so that we can find ourselves in such destitute situations, that we now have to rush into, with, those kind of actions, sometimes that are quite, say, compared to the scale and magnitude, of the problems that we are facing, really quite modest, but they make, the big headlines. Of course, they appreciate it, everywhere they're happening. So, but it also begs the question, where were we? Where were we before that? And this is a very important question in terms of, building the trust. Because that kind of attitude and behaviors will not be building the trust we need. It will make it extremely difficult, when private partners, later on, in the middle of an epidemic, in the middle of a crisis, would like, to have programs, such as, let us say, vaccine trials, treatment, trials, where then people will ask, well, why now? And why only about this particular, pandemic? Is it because you care about it, or you care about us, And then it is often what is, explaining, how communities, react. Those reactions are not necessarily a response, but these are reactions, that people simply are overwhelmed and they don't understand. And now it is even more dangerous because you have, with the amplification of fake news and the campaigns of anti-vax people, and then all the skeptics, that are poisoning, all this environment, with, well, the global south is only be here to serve as guinea pigs, to experiment vaccines that will be served, in the north. People will come only for issues, that care about, and, the real issues that you're confronted with. We promote these wonderful public health measures and barrier methods, with the washing your hands, I don't know how many times a day, where's the water? You have to do it with soap, what is this soap? And we mentioned in the first part, of this workshop, all the other underlying conditions that people are suffering from, that are kind of put aside with a greater focus, on COVID. And of course, that will be leading to an excess mortality, that will be much more important than the direct mortality related, to COVID itself. And of course, in such an environment, faced with such circumstances, how can we really, build the trust, that is, required? Well, we also have to understand that when we talk about private sector, so in that spirit, private sector then is much more than the corporate sector. You have that component of the corporate sector, but you also have all the other private actors, that do matter, because a true national response to a pandemic like COVID is more than a government response. Like you will see at the global level, a true global response is more than a UN response. It will be involving, private actors, will involving corporates, and at the level of countries, of course, it will involve, communities and their different forms, of organizations, because quite often, and COVID is one example, but we had it with Ebola, we had it with many other health crises. We often, have to intervene and then respond to the greatest health challenges in those places where health needs are great, but there is often no doctor. In those places, where majority, I would say, of the population is composed of youth and children, and it is not rare that in the countries, where we work today, population age, between 0 to 35, make up to 70% of the whole population. So yet there are no schools, yet there are no possibilities, of employment or a kind of a dignified, way, of living. And in those places, often there is no peace, because we will have to eliminate, disease today, in places that are affected by conflict. Those last miles that we're talking about, to eradicate polio, where they will happen, where we will have to fight, the last Ebola case. It is in Beni, in Butembo, so right there in the Kasai region where there's conflict, or at the border of Pakistan and Afghanistan as far as polio is concerned, where there is conflict. In northern Nigeria and the Sahara, for many other, diseases, that we will see, just to name, some examples, which means that we have to broaden the base, of public-private partnership that will, of course, involve, the corporate sector, that will involve, government, but also that will involve those other actors, that are private, that also will be contributing to building the trust that is needed and create, the enabling environment, that will allow, to deal with difficult issues, because we will have to work on new diseases for which we do not have all the solutions right from the beginning. We don't have, the vaccines that work straight away. We will use language that is not always understood by communities. For example, so it's obvious in our midst when we talk about an experimental vaccine, well, you translate that in the languages, of the communities that are affected, against, the background of the anti-vaxxers and then the skeptics, poisoning them with the ideas that they're being used as guinea pigs. You can understand the kind of reactions that you may face, for that. We have seen the kind of a disruption that we have experienced as far as the global supply chain is concerned. The colleague mentioned that before, and the lack of global platform of solidarity for an equitable access to goods and commodities, which again will call for governance at national as well as at the global level. And of course, that does not say very well about our world today, which is fractured more than ever before, where we will see, lack of leadership, which is broken down, to provide us with a common platform, to do, that kind of a work. So sustainable PPAs, much engaged, with communities, to build the trust. And again, in order to do that, we have to be there before the crisis, during the crisis, and of course, after that crisis. And that is a journey that we need to travel, that journey that will force us all to be humble. And that is the humility, that will bring us, to learn, from each other, and then to adapt, the solutions that we are drawing, in the kind of environment, that we are facing. The humility, not to think that we can all come in with the solutions that are already made. There's no quick fix. And then the humility also to understand that none of us alone, can face it. And the humility to lead to more respect, as we would say, for each other, respect of the corporate and private sector, that they also want to do good. They want to do good, for society, even though, they can make also, they can draw benefit from it. Why not? And, the humility on the other end, that they're not the only ones, with the solutions that can be imposed or dropped, on people and on those other partners. So in conclusion, I would like to say that pandemics and epidemics, they start in communities. And if they end, they will have to end in those communities. Now, to be mindful of that right from the beginning, and then start the partnerships right there where it matters, is critical. Today, we use, all of us, the buzzwords that we need to make an extra effort to walk the last mile. Well, if that is where our problems is, that last mile should be our first mile of response. And I think that's, where then we'll contribute into sustaining the public-private partnership. So thank you for the opportunity to make this contribution, and look forward to continue engaging with you. Thank you.
Thank you, SD, for the honest presentation. I'd like now to hand it over to Trevor to present.
Thank you, Allison. Well, thank you, Allison. Thank you, Clarion. Thank you, Joe, and Lisa and Claire. Thank you for the hard work that's gone on behind closed doors and leading up to this great event. Thank you again for the opportunity to talk with you all about COVID-19. And the past 4 months have been quite something for us as a company, and I think as an industry. And then we have some very direct reflections on the environment for PPPs. Alex, if I could ask you to turn the slide, please. So given that Medtronic is generally not known to consumers, despite our position as the world's largest medical technology manufacturer, I figured I'd put up a few little numbers for you to center yourselves on in terms of our reach. One thing that's not here is, again, how many technologies that we're producing, and that's about 131,000 different technologies now in production at Medtronic alone, let alone all of our sisters and brothers in the medical technology industry all around the world. Lot of stuff to keep track of, and perfection is obviously something we reach for every single day. So you could see PPPs is right at the bottom. There's a little bit of a formatting thing maybe with this slide, but the PPPs are right at the bottom there, and it's not coming well across in my slide, but PPPs is a very clear focus for us. Alex, we go to the next slide, please. Right, so just a clarification on how every single organization thinks differently about PPPs. And we think very, very broadly. I think most people would think of PPPs in healthcare around something, you know, that maybe be a diagnostic PPP and own and operate in a hospital. Everyone's going to come up with a different vision of what they think about as a private-public partnership. But so it's important for us, and I don't know many of the people on the call, to talk about this. So obviously the captions above each one of these, we call them the 4 lanes, are rather self-explanatory. Research and development, everyone wants to move up, governments included, the value chain. We want them to move up the value chain. We want to partner with governments around moving up the value chain. That's really, really very important. You have the second one about manufacturing for market access. Many countries around the world well, technology moves very, very quickly into some of those markets. Pharmaceuticals may move a lot more quickly, but there are certain areas of the world that want medical technology, advanced medical technology manufacturing, and are willing to give up health system equities in order to do that. And those are certainly a form of private-public partnership. Then we have clinical training and education, and that's something that people don't think a lot about, but I think all the medical technology companies today add a lot of value, not only in terms of upfront training around new and advanced technologies for the healthcare system, private and public. You know, our colleagues are sitting on the insides of those ICUs. They're sitting here literally setting up the gowned up, they're sitting with the clinical teams, providing guidance to the operating physicians. It's shoulder by shoulder, ladies and gentlemen, and clinical training and education is critical. I'm actually going to come back to that multiple times during the presentation about that, because I'm probably the most enthused about that particular lane. Then you have health system strengthening. I've already seen a question in the chat box around health system strengthening, and that's basically using the Stanford School of Design concept, which is give me a problem, we'll try to figure out how to solve it. Don't worry about the details. Don't worry about these 131,000 medical different devices that may be in production and all the health system complexities. Let's focus on what the problem is, and then let's figure out if we can build teams around the problem that might include us, might not include us. And that's what we talk about. And it's usually around a particular disease state in a particular population. And I think I'll keep it right there. So Alex, next please. So first, and this is going to be a click through, Alex, you know, our mission was founded in 1960 and has not been changed since then. All of these things. We were founded at a humble company in a garage in Minneapolis, Minnesota, the inventor of the pacemaker. And I would say at times we find ourselves a little bit uncomfortable with the kind of the attention that we're getting and actually the size that we've attained all the time. I think our colleagues up in Minnesota frequently think about that the company's a lot smaller than it actually is, and that's very nice. But they also you know, really focus on this mission statement. This mission statement, I can tell you 24/7 has really guided a lot of the actions that I'll be telling you about. Not only the actions that we've taken, but other companies within the industry, which is perhaps even more important. But if I could click through, Alex, just a couple more, one more. There we go. One back there. They're perfect. So we actually did an internal analysis. By the way, I excluded about 70% of the internal actions that we took within our own company that were directly tied to our mission, but were human resources and personnel related that might be sensitive, might not be broader known. And I limited myself to some of the public actions we took as a company. So the big one, and I'm going to talk a little bit more about it, is that we released the intellectual property of a portable ventilator. Just so everybody has a sense of what that meant. I'm going to come back to that in a second. We worked again with international organizations around biomedical technology. There's a lot of people around the world, and that continues to be the case today. They knew, I know this sounds incredible, less about a ventilator than even I did. And they're generals of major countries. They're lots of decision makers, non-clinical decision makers, and people that may be medically trained and in super specialties, but yet had very little ideas around the technologies and how they were actually related to the COVID-19 crisis. I mean, I was in Africa when I first heard about COVID-19 with my family in Madagascar, and I said, this is an infectious disease, Medtronic, we don't have all that much to say about it, but you know, little did I know 3 weeks later, we were literally working 24/7 on this, and every single weekend, and we've not had much sleep since then. And that's the same with a lot of healthcare systems around the world. We've had to work hand in glove really with the WHO, these major international organizations, some of whom are quite skeptical around the private sector. But we've been able to find this modus vivendi in a way to work together that builds trust and advances public health. And that's something we're very, very proud of. We welcome the skepticism, but we also welcome the trust. Remote management. So we've worked a lot. We have a big partnership with Intel. Probably everybody in the United States knows about the Javits Center, the big convention center in New York City that was converted to a hospital, for lack of better terminology. We partnered up with Intel Corporation to basically be able to control those ventilators across the entire Javits Center and do so remotely. Obviously, doctors and frontline healthcare workers being very directly exposed. So that was done extremely, extremely quickly. I'll leave it with that. Collaborating with others. So we've taken the lead, obviously as the largest medical technology company, we have something of a responsibility. We've collaborated a lot with the other big producers of ventilators in a lot of really, really important areas. Much of those have been with respect to the US government, with respect to different governments, with respect to the United Nations and that type of thing. So one big thing people don't think about is how complex ventilators are. It's not a two-piece, just put it together device. Our most simple ventilator has about 500 parts to it, and with a global supply chain, our more advanced ventilators, and this is the case with probably other manufacturers, have upwards of 2,500 components in advanced global supply chain. So you can imagine the difficulty that was when not only we were asked to up ventilator production, but at the same time also incentivize and keep stable those other suppliers, which are often small and medium-sized businesses, mom and pop shops. Very difficult, and all of us had to work together in the right way. We committed publicly also to not raise prices. So this is a very, very important ethical bound, and we've kept it there. Obviously, there are some limits to when we sell into markets. We use distributors. We cannot change their contract, but we absolutely not raised our prices during the crisis and continue to do so. And then we founded something, and perhaps this is our marquee sort of big tent effort, is something called the Ventilator Training Alliance. We realized with that in the crisis situation, all medical professionals, no matter where they may be, are crossing over into each other's domains. Nurses possibly even going into medical doctors, some specialties going into other specialties. And then this is happening across the world. And all of a sudden you have this influx of major advanced medical technology coming into a lot of places that have not hardly seen or it's been rather distant to them. Ventilation and literally 150 other technologies across the entire spectrum, including some devices that are the equivalent of open heart surgery, ECMO devices, right? And so we created something, and we share that alliance today with about 20 other organizations called the Ventilator Training Alliance. So this is a simple app that basically has education and training materials about all the different ventilators, be them Medtronic, be them Philips, be them GE, be them Draeger, any of the other ones out there, and made sure that was available. This app has been downloaded into 170 countries right now, and is being translated into 13 different languages, is my understanding. So this has been a big plus, hopefully for the world. It's certainly been a mission for us. Okay, Alex, we can go to the next, please. All right, so just to summarize a little bit, I mean, obviously we've had to increase supply, and I'll talk to you a little bit more about that in a second here, but fighting against trade restrictions, and some, I think it was Dr. Assi or is it Brenda before, there was this issue of protectionism, and it's very important to talk about that. It's, let's say, protectionism when it's related, in our particular case, to people and product, right? We talked about global supply chains. At the same time, we've also talked about people restrictions. Singapore to Malaysia, where of course people, they've tightened up immigration, right? The movement of people and these type of things. All of those have had dramatic and important impacts upon the global supply chain. Obviously, yes, you're right. There's a lot of competition going on amongst the different countries. And yes, some of those same countries, I think this is you, Dr. Assi, we're talking about, they have actually leaned inwards. And many countries that you would not have thought would be the first movers when it comes to trade restrictions have actually been the first movers. And we've experienced that very, very directly. A lot of screaming voices on this particular point. And then the human expanding community capacity. People think a lot about technology, but they don't think about the whole ecosystem that actually supports that technology. And we can put ventilators wherever we want in the world. Yes, we could, but that doesn't necessarily and directly benefit public health. So making sure that that human infrastructure piece, be it nurses, be it doctors, be it anesthesiologists, intensivists, has to be in place. And it has to be in their languages of preference. Be it Amharic, be it, you name the languages, we must be there. And that's where we have to, and we've been doing. Now, globally, I'll just rattle all the organizations off that we've been working very closely with. The WHO comes to mind, UNICEF, UNOPS, UNDP, UNHCR on the United Nations front when it comes to the development banks, Islamic Development Bank, World Bank, African Development Bank, EBRD, Africa CDC, and then, of course, the Asian Development Bank, and then, of course, the unilateral donors such as USAID. Wonderful work being done across all of them. We've had a dramatically changed relationship from being, frankly, an invisible country, probably in an invisible, largely invisible industry, to being the, kind of the center of the political discussion in a lot of these countries. It's to be honest, not a place that we're used to, but we try to do the best with it. With good heart and good mind, and we'll talk a little bit more about that. We can go to the next, Alex. Okay, so this is the ventilator market as of January 2020. You see the major players, you see the fringe players, you see which players on the right-hand side take up about 80% of the global supply. Very, very important, and to really understand that 60% of the global supply of ventilators, and again, I think that ventilators are just a proxy for what we're talking about in terms of high technology. PPE diagnostic testing is much more globalized than is high technology or medical technology. So it's about 60% of that based outside the United States, and not only that, but a good part of that supply chain, the upstream supply chain, based outside the United States. So that was the case January 2020, when nobody had a real idea globally, or maybe just a few people did, but where this was actually going to go. Alex, we can go to the next, please. All right, sorry, it's my bad picture, but this is from the Wall Street Journal, and this is our ventilator. So to get an idea, that PB 560 is a relatively inexpensive, very relatively simple ventilator, portable ventilator. You know, who would have known? I call it the shot heard around the world. We literally had, I estimate about 250,000 unique organizations downloading the intellectual property on that device that you're looking at right in front of you there. Now, to the next slide, if we could, please. And by the way, we salute any be it an academic effort, be it an NGO effort, be it whatever effort is necessary for them to move to production. We salute, but it's obviously impossible for us to help every single institution that we've been requested for help. However, we have, from one location that we had our ventilators being manufactured in, which is in Ireland, in the red there, we have multiple strategic partners now across the world, and some very, very interesting countries to produce that exact same unit, where we've, let's just say, we've added a lot of support and a lot of strategery around those particular relationships. And we have several other strategic partners we're discussing with around that device. It's been quite an experience for us. So I call this the democratization of ventilation. And that goes to knowledge, that goes down to the actual production of it. And that's where we've made a big mark. And incidentally, for those proud Americans also, we opened up a factory with Foxconn in Wisconsin last week to produce that exact same unit as of Thursday last week. So this is very much a hot issue. We're not looking back here. We are very much looking forward. We can go to the next. And then we've got just a couple more slides. So what has it meant for us? Sorry, the slides got a bit messed up, so apologies for that. But you know, we're really high on PPPs going forward here, given what we've actually seen. We were always enthusiastic. Joe, Clarion, you know that well, about how enthusiastic we were about PPPs before C19, but we're even much more enthusiastic after C19. For the first, and on the left-hand side, we've talked about reputation and trust. Again, we live in a very large company, 95,000 employees, but in an industry which people don't understand is largely out of sight, out of mind. And so governments, I think, have got their minds open to the industry, what it can do, what it can't do, our limitations, our possibilities. And so our reputation, we've been getting calls from governments all around the world that we would have never expected. And I think from that has come a lot of trust. Meanwhile, some of the governments are wanting us to do things that probably are a bridge too far, at least in the near term, and that's life. But it's wonderful to have that request and have that visibility. Then we're also enthusiastic because of the epidemiology, because not only is it respiratory in which we're particularly involved in, we're involved in all the others. As you know, COVID unfortunately takes itself out on multiple other disease states. You have young people having strokes, you have renal dialysis issues, you have potential cardiac diabetes issues and that type of thing. Medtronic is there, we're at the table, that's our bread and butter, that's where we've always been, and so we're very enthusiastic that we can meet those extra demands beyond that. And then finally, it's about the governments themselves, because we obviously, it takes a little bit of desire, and maybe it's because the governments need the resources, but it's also because I think they understand what the private sector can bring to the table that they don't themselves have. So that certainly creates a better environment. And then this issue around governments' diminished inhibitions to talk to the private sector. We've really experienced that 24/7, 4 months. We couldn't be happier. And let me talk in my final slide how I think that may translate to a better PPP environment for us all. Next slide, please. And that'll be my next to the final slide. So what we're seeing, and I think this is important for everybody, is that we're moving from the tactical to the strategic. So the crisis goes on, be it we're in the first wave, second wave, whatever it is. We need to go beyond medical technology procurements. If we don't think in the health system strengthening lens, we talk about education, training, making sure even if they're low-cost ICUs, that we have that treatment and that these are well integrated into public healthcare systems. Frankly, you'll just have a bunch of great, well-functioning ventilators in the back of the hospital that aren't doing very much of anything for people. So we're very much talking with those same international institutions that on the one hand are still in crisis mode, but we're saying, please think about this next step. From hard infrastructure to multi-specialty hospitals to asset-light investments, so IT type investments, things that can start very quickly, where it really starts with, frankly, mom and pop, an idea in the garage, these type of things, but that can be very quickly implemented and with great impact. We're doing a lot of this across, we're today the largest operator of cardiac cath labs all around the world, but at the same time, we have very specific offerings in the C19 area that we're putting into place. Most of those are very, very asset light, IT driven type of investments with smaller, medium-sized companies, very interesting things. And they can get up and start running. The horse can start running immediately. It's very interesting. From the government perspective, lengthy, complicated negotiations. And by the way, big companies like us sometimes like the government. We can be a bit slower than we'd like, but I really think that those negotiations, the time of negotiation, is going to be dramatically reduced. And we're going to move much, much more quickly to speedy movement, actions. And I think we should all feel very, very much encouraged about that. And then my fourth point, for our colleagues that are in USAID or other such agencies, World Bank, et cetera, all are going to really play and already are playing a much, much more important role, not only in terms of the actual money, the loans and this type of thing, but in terms of technical support and ethical guidance for PPP guidelines. People like Imad Fakhoury over at the World Bank, the IFC, all the PPP units in the respective countries all will really benefit from having that increased involvement. And then the high touch environment to the remote everything. Now, just anything that we can do in our company right now, we call it the remote everything. Anything that can be done, remote training and education as an example, is being done. Remote monitoring is being done. All of these things are being transitioned. Every single device that we have in our own company right now is being looked through an IT lens to make sure it's got the chipset, making sure it's got the software, making sure that what can be enabled very quickly for that very low touch environment is being done. And then finally, on my last slide, just my contact information. We do really welcome your inputs. We welcome your criticisms. We welcome your suggestions. And yes, that's my direct telephone number and my direct email address. Very happy to hear from you. So thank you again, Allison.
Thank you, Trevor, for the insightful presentation about the Medtronic model. So we're now going to move to our final presenter for today in this session, Dr. Diarra. We'll hand it over to you.
Thank you very much. Hello, everyone. I'll try to share my screen. Oh, it's on. Very good. Thank you. I have the privilege and the honor to replace our medical director who has just been called for urgent meeting. As you might know, if you watch the news, cases are ramping up in Texas, and there are more measures to be put in place. I will be presenting how the company ExxonMobil is preparing and responding to COVID, and it's divided in 3 parts. The first one is related to what is ExxonMobil vision for global health, knowing that you always have to consider local solutions. The second part is related to how we do it internally, because our focus from the medical department is really to protect our workers, knowing that we are not a bubble and no facility is pathogen proof, whatever you do. And the last part will be related to a take-home message in terms of what can be considered by others. And while my presentation will be focused on what we do internally, I have to say that I've been also amazed by how the company is investing in communities to assist in that domain. And the most striking example is how manufacturing lines for production of oil and gas products have been shifted to produce isopropyl alcohol for hand sanitizers and donated across different locations. But just to start with the next slide, it is really showing how we are looking at the global health aspects, and to really have a good preparedness and response, as many of the previous presenters indicated. No entity can do it all. With all the I would say the funding you can have, whoever you are from any of these partners, it will be impossible to tackle it completely. So the way we see it is that we have the public sector as a key element that is at the country level, looking at how institutions, regulations, plans are being done for public goods and services. Then you have the private sector, and within the private sector, as mentioned and others, it's not one entity, it's a multiplicity of entities where you have the private sector, for-profit, non-profit, different sectors. And it's important to consider that as a multiplicity of entities that are all interested in making it work. Then these 2 entities have to work with the communities, because as it was said too, the disease starts with the communities. And if you want to stop it, you really have to stop it with the communities. And the frameworks that we are operating into are related to the global health, meaning the international health regulations with WHO. Everybody is aware of the public health emergencies of international concern, and how the regulations are including a number of parameters that whoever you are, from the public, private, or the communities, elements are related to you. And from a local perspective, the fantastic job that was done with the Global Health Security Agenda, WHO, CDC, and many other institutions. Assessments of preparedness of countries have been done across the globe, and you can see where there are windows of opportunities to develop public-private partnerships to tackle aspects related to preparedness, detection, testing, and response. And this framework has been published in the Texas A&M blog, where there is an annual meeting on pandemic preparedness with members from the private, academia, and other groups. So they solicited some inputs, and that's what we have provided to them. But I truly believe this is something that can be considered by any of us to really look at the situation. The next slide will present how we tackle that question internally. And our main, I would say, mechanism is an emergency support group. Presently, and that's where our medical director, Dr. Vicky Weldon, is now, we have an emergency support group at the corporate level, but we have in each region a similar mechanism. And then at the country level, we have that mechanism also established. And within that mechanism, you have all the different key entities for the company that are combining the business lines, health, security, law, public and government affairs, operations, and working with external experts, we look at how to calibrate our measures. And our measures have been defined, like many other corporations, in our business continuity plans. And the aspects related to infectious diseases are being managed as one of the scenarios where the impact can be done at multiple levels from a geographic perspective, but also that can affect either our people, affect our assets, affect our environment, and also our business. And I would say that these aspects are really ingrained within our company culture. And I would say that while I know a number of participants and people that are here, I like to say that I'm a real, I would say, live example of the commitment of the company to tackle these issues from the ground level up to the headquarters. And we have tools that have been developed and made available to the oil and gas industry. It's one of my colleagues is saying it's like preparing the simple man's book, where if you are on a site, what do you have to consider to tackle an outbreak? That can be norovirus, that can be Ebola, that can be any infectious disease that can impact the operations. So that's how we have structured our system, and working with different at different levels with our business continuity plan and infectious disease. And the next slide is going to present how this is being broken down between the preventive aspects and the mitigation safeguards. And the preventive aspects are listed below on this slide. And the mitigation safeguards are what is deployed if you have a case to prevent having health consequences, safety consequences, disruption of the operations, loss of productivity, and also image and reputation being affected. And just to illustrate how this has been very well applied in one of our locations, just put yourself in having a case of coronavirus in a platform where people are living and working for weeks or in a row. And the unique mechanism we have established, and others are doing it too, is that prior to deployment to these locations, the employees, the workers are being kept in quarantine for 2 weeks. That's the incubation period. So they are kept there. If there are some cases, they are being tackled. And prior to deployment, just in case there would be asymptomatic who would come after these 14 days, there is a testing that is being done for a number of locations. And with that approach, we have one location that really tackles that in a proper manner, and no issue occurred with that. And the challenge we are facing with this pandemic is that we are all learning as we go. And there is an image that is saying that even all of us are trying to build a plane as we are flying. So it's to see, okay, where to look at the science, how to adjust, manage our systems, and how to work with the science to put in place the proper measures that can prevent and adequately tackle the situations when they occur. And I will conclude with the last slide. That is indicating the take-home message that we can share with everyone. And just like what we have in our first slide, is that we really need a strong public and private sector synergy with the communities to be successful in this pandemic and in general for good health programs. The second part is that I've really learned within the company. I've been on the company for 10 years, worked 20 years with different non-profit organizations across different locations. But in the corporate level organizations, it's extremely important to have the top of the company involved, but also work at the different layers, intermediate management, and down to the local level to have effective measures. And you need to build your response considering the local health system. So if you have to protect your workers in West Africa comparatively to Asia or in China or in Europe, you have different models that are in place and different ways of addressing the situation from the inside to the outside and vice versa. Working with the different systems is very important because that's where you can sustain your interventions and have adequate preparedness and response. And the other part is that to the communication within your own organization is very important. I'm sure that each of you on the call now is having different channels of communications, different senders, and also some communications are either for the executive level, for the general population of workers, the medical staff, or your providers or your contractors. So it's really to slice your audiences and tailor your messages to these different audiences. And the last point that is not appearing here, it's very important to have a global health, meaning a global approach, but the local solutions are really what to consider to make it work at the ground level. That's all I have, and presenting on behalf of our medical director. Thank you very much. Back to you.
Thank you, Dr. Diarra. That was a thrilling presentation. So I think we're now going to move into the question and answer section of the session. So I'm going to start off with the first question, and then we'll open it up to the forum members and then to the public. And I'm already getting some questions that are being generated from the interesting and insightful presentations that you've all shared. So my first question is actually a two-part question. So, through the thread of your different presentations, you've identified a range of themes that help to enable kind of the success to responding to COVID. So I heard things like openness to digitization and innovation, while also at the same time kind of staying committed to scientific rigor and an evidence-based, the importance of building trust in the midst of a pandemic, which also can prove challenging, and also the value of maintaining a commitment to the local perspective, as well as an accountability and understanding of the local public health infrastructure and health system. So, that's what I gleaned from it, but I was wondering, what other enabling factors do you believe had made your ability to respond as an institution or through your organization successful that others could benefit from in order to bring into their own institutions and organizations? And number two, realizing that some of those factors might be different from how you typically operate and navigate in your organization. How have you navigated these enabling factors in this new environment in your own organization where there might have been some tension? So that's my two-part question. And does anyone want to respond?
I can start, Allison, if that's...
Thanks, Brenda. Sounds great. Yep. Open floor.
Yeah, so I mean, I think you did a great job of summing up some of the key issues. I know for us, being thoughtful and not, shall I say, resisting the urge to just act without thinking. And that was not easy. There was a lot of pressure being put on us from external sources. I was actually putting pressure on some of my own colleagues to better understand, what's the plan? What are we doing? What are we doing from a scientific perspective? And, soon realized that, we had decided we were going to take a more thoughtful approach and really step back and look at where our core capabilities could be used the best, what collaborations that were forming out there would make the most sense for us. When it comes to sort of development of medical solutions, just ensuring that we were targeting the ones that we thought had sort of the best likelihood of success. So I think thinking about what you are going to do is really important, and really just trying to resist sort of that urge to jump in. And this has been something we've had to deal with internally at Merck as well. We have very passionate employees, and I love them dearly. But they never make me crazier than when there's a crisis or a disaster, whether it's an earthquake or a hurricane or a pandemic. There's this barrage of ideas and questions about what can we do, when can we do it, how can we do it, what can I do? So just being able to stay kind of calm in all of that, encourage people to be thoughtful. We want to, we like their ideas. We don't want to discourage their creativity. We don't want to discourage them from sharing, but we also want to make sure that whatever we decide to do is well thought out and not just reactive. So I think for, when I think about your two questions, for me, they kind of come together. And just making sure that we're being very thoughtful about it and managing all of the demands that are facing us at a time when people are feeling really uncertain and feeling like they need to contribute.
Thank you, Brenda. Very, very insightful.
Yeah.
What do you think, Dr. Arce?
Yes, I just wanted to add and re-emphasize the importance of long-term engagement and presence. And that is always also linked, to the trust building as well, but beyond the trust building, the sustainability of the partnerships, that would like, to see. And that is also a way to contribute to investing in preparedness, because one will have a better understanding of the environments, the better understanding of the challenges and the gaps, that needs to be filled, and the opportunities, to prepare for the next shocks and hazards, that will be happening. I will tell you a very short anecdote. So I used to work in a very difficult conflict area where there were many, rebel groups who took over and then decided to ban all international organization to leave. And if you know the groups I'm talking about, if they tell you to leave, you better do. And so I nonetheless try my luck and say, okay, let me talk to them and see if we could still provide some humanitarian assistance. So when I was talking to them, before I even start making my case, he said, okay, you can stay. And the reason he gave was, you can stay because you never left us. So when people knew that we managed to stay, they were praising me for negotiating something incredible, but in fact I negotiated nothing. So communities and then people, they just remember, and we shouldn't forget that. They remember who has been always there on their side to accompany them to respond, to their needs. And that was the main argument where he said, in very simple words, you never left us, so you can stay. That everybody else. Yeah. So I think I'm just want to re-emphasize, how important it is, to have this long-term partnership, this long-term commitment, this long-term presence, because we're dealing with very difficult issues that will force us, to be there to accompany each other.
So guts and humility, if you don't mind. It sounds like we're going down the line here, Dr. Assi. So, guts and to modulate, know what's better in each circumstances. I would have. I'm a very mission-driven person. We've talked a lot about our mission. But despite my great trust in our own leadership, I was really agape at our decision to let a lot of our intellectual property go. But that was guts. That was really guts. I think it was the most politically daring thing that I've seen in my 16 years in my company. And most people in our company had no idea, thought of it as something, just quite natural. We wake up in the morning and that's what we do, and I'm like, okay, and the prime minister of XYZ country agrees with you. But then there's humility and on two things, right? So number one, we know very little about the disease, to be completely frank, right? We know a lot, but there's a lot more it seems to be known. So in the face of a tsunami, you run away from the wave. You don't just watch it envelop you. There's also the humility of knowing what we can, and still, like, the whole medical technology sector is, the demand greatly exceeds the supply. And it will probably for at least a year, probably. And that's the whole global medical technology sector. So having to figure out a way to say no to people, to set those expectations, and to give people bad news, although that is the news that has to be delivered, is all very important.
Malik, Alison?
Yes, please go ahead.
Yeah, I will just add one word, which is agility, because it's very important to see how to be nimble, adjust your plans. It's good to have plans, it's good to have conviction, to have the trust, but as we go, and most of the situations, it's like, yes, you have a roadmap, but you can have bumps on the road. So it's to see how to readjust your plans, how to work with partners, revisit the goals, how to accomplish the activities, so you can get to a good level of results. Because if you make plans and you say, oh, we should not move from the plan because of this, and it was done at that time, I think it's something to avoid, and see how to adapt to the situation, just like we do with the COVID, because, okay, how do we know is a transmission? Do we have asymptomatic or symptomatic transmission? All these things. So it's really to keep that mind of, okay, let's be alert and let's modify the plans as we progress. Thank you. Back to you, Alison.
Great, thank you. So we're going to add to our list, resisting the urge to act, the importance of long-term engagement and presence, guts and humility, and agility. So thank you. So we have a couple of questions from the public. The first one is, I guess, it's a bit more focused on some of what you all raised around the public health system and the role of the infrastructure and the importance of community relevance and engagement. So the question is, what is the private sector's role in sustainable health system strengthening in the context of a pandemic? And I'll just leave that open to anyone who wants to start.
I can start.
Thanks, Brenda.
Being part of the private sector. And I did see that question out there. I think at the end of the day, governments have a responsibility, local communities are critical. But I think every single speaker has made the point today, and I think it's a very valid point, that particularly in a situation like this, and even just generally, these problems and these issues, health strengthening, sustainable health systems involve everyone. So I do think that the private sector has a really important role to play in all of this, whether it's, supporting activities that are going on the ground, helping to move forward, preparedness, building capacity, putting the right policies in place and practices, helping to expand resources. We do have, as the private sector, we do have resources to bring to the table, and it's not just money. I think one of the things that we recognize is that even from a human resource perspective, we have a lot to offer. That said, I do think that it needs to be a global and wide-ranging approach that involves all sectors. So I think there shouldn't be over-reliance on the private sector in this regard, but I also would love to see as the years go on, and we are seeing this more and more, that the private sector is being embraced in terms of how we can help and how we can support governments and communities.
Thank you, Brenda. It sounds like Dr. Diarra wants to add to that.
I can build on what Brenda just said, and I think that one very important role is for the private sector to understand how the public sector works, and how they are organized, what plans are in place, and what needs exist. So that's really a first part, and from there you can define what common goals, objectives can be tackled with a common understanding, being able to deliver when you have indicated what you will be doing. And for me, I like to joke sometimes, and I said these partnerships are just like dating, because you meet people. You meet one person. I will just take it as an individual person. You meet someone you like. You work together. You go out once, and then maybe you can continue for the long run and have kids and all that. But it's really how you get into the head of the other person and the other sector to really build an alliance to tackle the situation, knowing that private sector, you have profit, non-profit, public sector, you have different types of public sectors, international, national. So just to add on that part, that it's really important to better know each other, to be able to work together for the short or long term.
Yeah, and Allison, if I could just react to that, because
Absolutely.
I think that's such an important point. And Peter Sands, I think, even made this point earlier when he talked about the need for a mix of people with different mindsets, different experiences. And I know for us as an organization, years ago, we started to recognize that we can't have everybody who thinks the same way. So I know with my own team, I started to look for folks that had more public sector or non-governmental or government experience to bring into the fold, so that we could create an organization where you had people who understood how a business works and the mindset of a private sector, but we also could bring into our four walls folks that also understood the public sector, government, how government works. And I think, to your point, it's really important to have that mix of skills and to take the time to really understand and have those conversations so that we can better understand one another. So I think that's a really tremendously important point.
Thank you, Brenda. Dr. Diarra, does anyone else want to comment before we move along? No. Okay, great. So I have one more. I think we actually have time for one more question. We caught up on the time front. So there's another question from the public. I'm just pulling it up now. And it's about the issue of trust that most of you had identified as a critical factor and something that takes time to evolve and develop as part of this dating game that Dr. Diarra described. So the question is this. So why, Dr. Assi, you mentioned why now, And there are many questions that arise when private organizations approach the public sector. So this person would like to know, I think we'd all benefit from knowing, how do you think the public sector creates an environment of transparency that can mitigate any skepticism about motivations in that partnership?
Well, it's about good governance and accountability. So you cannot judge, the whole public sector, through, the same scale. You have those ones that, have a good accountability mechanisms and a good governance in place, trust built, with their communities, and then you create an environment, where you will have, transparency and accountability, where all, partners, feel, comfortable, in. And those ones, exist already that one can engage. They're not all at the same scale. They're not all on the same list of Transparency International. They're not, on the same list of the World Bank credit rating. So you will have now to deploy your level of effort, depending on the baseline that you find. And I think that is that, through that engagement, we've talked about, to learn from each other, to support each other, to clearly define, the rules, of the game, that you will, manage, to get that. It may not, happen overnight. I think, Malik was talking about all the bumps, around the road, where we'll have to be, humble and then learn and adjust and then, but, adjustment and compromises, they don't mean what we call in French compromission. So there will be, lines that have been drawn, because then otherwise one become accomplice, for either, lack of good governance, lack of transparency, or corruption, or whatever, that might be. So one has to be fully aware, of those dangers, fully aware of those challenges along the way in order to manage them. But at the same time, open and be humble, as more colleagues have said, to engage in that. So, but I think there's sometimes a lack of humility even in the question. It is as if, it is the private sector who's going to be teaching, the public sector to, to have good governance and then to be transparent and so on. I think the same thing you can find in the private sector as well. They're not all at the same scale, the same level of transparency and good governance and I would say, decency, in many ways. I think that the same, should happen there. As we said, all of us, I think right from the beginning, a partnership, it is a two-way, kind of a street. It's an accompaniment. There are mutual benefits, mutual learning, mutual support, and an accompaniment. It shouldn't be, the ones that are coming, I think, with all the solutions and then, with all the, right, I would say, values, and then the other ones that we need to also to teach and then bring on board. I think let's be a little bit more humble there. It is not how the private sector will influence the public sector in that regard, but it could be vice versa as well. So that we all have to abide to the same, values and principle along the way.
Thank you, Dr. Assi. Is there anyone else that wants to comment?
Yeah. Allison, if you
Trevor?
Yeah, thanks. Yeah, I mean, you're absolutely right, Dr. Assi. In what I would say about the government, I would say absolutely the government has every right to expect of the private sector in return. And these are the things I wrote down. Just a stable legal environment does wonders for transparency, right? And I think that sets the rules of the game on both sides are critically important and should be the basis. But you have to also recruit the right people on both sides, right? So, we have these PPP units. The one that comes to mind is a PPP unit in Kenya. We had young, very well-trained people in a PPP unit working for the finance minister, incredibly smart. But you also have to have the equivalent piece over on the private sector side. because people are liable to misinterpret each other's intentions. And then I think it is the right structure, just institutionally, which is finance ministry tends to be a very, very good place, because they ultimately tend to be the arbiter of, what is good for the country in terms of budget priorities, in terms of what's going to be offered and help. And that's, by the way, back on the, that's the CFO, in my view, back on the corporate side. And I don't see very many, corporate CFOs usually being involved in PPPs, but those are the equivalents, right? And then building strong and well-educated teams on both sides. And let me there's a process that the World Bank has gone through, which I think deserves just a quick highlight here. Did the largest procurement reform, really, almost in the post-war period, that probably wasn't noticed by very many people. It's a movement from, in essence, from low price equals technical qualifications to best value. Sounds right. That's the way we make our decisions every day, best value. So why wouldn't procurement reflect that? And the World Bank pushed this through. And Chris Brown, who's the Chief Procurement Officer, Enzo De Laurentiis today, the Chief Procurement Officer there, it's engagement with the private sector, like admitting the legitimacy of both parties, getting everybody in the room and creating that type of engagement atmosphere. So at the end of the day, it makes for a very, 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 very trusting, and it really flattens the world, flattens the playing field, and makes things a lot more transparent. And so that World Bank process has been a great one for us. It isn't directly related to PPPs, but the lessons are. Thank you.
Thank you, Trevor. So we're now at the point of the end of this panel. Before I hand it over to Clarion and Joe for closing remarks, I just wanted to express my deep appreciation, I think everyone's deep appreciation for this terrific panel, the insights that you provided, and the candid perspective you shared based on your deep experience working in your own institutions and through public-private partnership around the opportunities and risks and way forward for all of us to benefit in trying to do the best we can in the midst of this pandemic. So thanks to all of you. I wish we could give a round of applause, but it's invisible, but it's there. Thank you.
Thank you, Allison. Well done. I appreciate it. I'm going to go back to a statement I made to Dr. Sands earlier, and I think it has been really, every speaker, whether it was Brenda sitting there talking about what it's like to be in front of a group with the desire to do something, but maintaining that sort of sound scientific approach, bringing in people to help out who are in the medical community. Dr. Asai, I cannot imagine what it's like to go to people who may cause you some harm and to say, I want to talk to you. I used the word with Mr. Sands, and I'm going to use it again now. In all of the work you do and how you do it, courage comes into play. You're talking about public health, you're talking about protecting people, but not necessarily with a return on investment that they can initially see. You're really asking people to invest in you in everything you said, whether it's me, Dr. Diarra coming in on short notice with a talk. I mean, this is what you do every day, each and every one of you. And again, trying to follow the sound science, the sound business acumen that you all bring to the table is why you were chosen to be here today. What we wanted from you, you have delivered in spades. Each and every speaker today has done exactly what we hoped you would do when it started. Despite a few little electronic glitches here and there, it didn't impact anything with regard to the end product. And again, the words that were used regularly by everyone that I thought was so incredibly important: discipline. The discipline that you all bring to the table with regard to your special talents, but the ability to take that and sort of use the sort of constant learning mechanism. I get the sense as each of you talk about what you're doing, how you're approaching it, you're learning, you're writing it down, so there's a duality. to how you're approaching this. It's already written to some degree how you will end this chapter in handling this, because you're learning as you go. There is a thoughtfulness. I mean, when I go back to duality for a second, it's the working, it's the planning, it's the learning. And again, I think that those of us who are in healthcare fear no one greater than the finance minister, because they're going to ask us to really be specific about what we're talking about. Where feeling good is not the most important thing. How does it manifest itself? How are you going to show me that you have a long-term plan? Again, every speaker has addressed that. Again, I would say that you've all been able to delineate very clearly the forces you face. I now have a sense from every speaker when they're sitting at the table, what they've dealt with to get to where they are, and what, to some degree, what their expectations are from me, whether it's the government, whether it's a private enterprise, whether it's academia. I mean, to see a cargo ship with, I'm sorry, 1 million washing machines gives me a different impression about transport and barriers and trade. To have someone talk to me about vaccines and medicines outside the US, how that plays. To have Trevor talk about taking a ventilator and just dispersing the patent so that others can use it. What the long-range implications are, what the societal implications are. We are global, whether we want to admit it or not, and our world is now a pandemic world to a great degree. So the teachings have been immense for me. I'm hoping that you will take this away so that when you're sitting down and you have your reflex of who should be at the table when you're discussing something, you actually have much more of a, many more arrows in your quiver to go forward, and to know what your other colleagues and members of this panel, and I would call in another vernacular, teammates have to bring and to share. I could have asked no more of you. I do think that one of the things that does come across, and I would use it behind your backs to describe every one of you, and that is a tempered wisdom. Your wisdom is non-threatening. Your wisdom is there to get the job done. There is a selflessness about each and every one of you that I would have at a table with me wherever I went. So those are my remarks, not necessarily concluding because there's tomorrow to come, but I think that the sense of who you are, what you're capable of doing, and how open you are to learning and sharing came across in a uniform fashion. Joe, if you're on the line, might you want to say something else to add before we close?
Thanks, Claire. I know you're always a very hard act to follow, so I really appreciate what you said and share your feelings about our colleagues as well. I only wanted to raise one other issue. I'm sorry.
You may have to go off of visual to just sort of conglomerate all the electronics into just your vocal.
On technology. Can you hear me?
Can you switch off the visual for a second?
Okay.
And just go to the verbal?
Not. I'll demur. It doesn't seem to be helping. So let me just reinforce what you said, Clara. And, oh, you can. I wasn't sure.
Well,
yeah, 2 or 3 points. One was just about all day. Can you hear it or not?
Yes.
Some people are sending me messages that they can't.
I'm sorry, Joe. I'm sorry, Joe. We can't hear you.
Let me just reinforce what you said,
Joe, I'm sorry, we
Clarion,
can't hear you.
and look forward to tomorrow to take this. Yeah, thanks.
Oh, we're so sorry that
Bye.
unfortunately.
I'm leaving the line, and just thank you, Lisa. Just thanks. Yeah. Okay. Bye.
Bye-bye.
Lisa, can you close and give us some instructions about tomorrow, et cetera, et cetera?
Yes, first off, just thank you all so much for your participation, for your contributions. Thank you to all of the audience that comes from pretty much every sector and from individual medical care providers up to NGOs and parts of government. We really appreciate all of you listening in and taking an interest in this workshop and in our forum. Tomorrow we will be on at the same time, and our keynote speaker is Chris Elias from the Gates Foundation. Dr. Zhao is joining us again for a short time, and then we're going to be going into some really interesting sessions. The first is going to be focusing on PPPs for global public goods in reference to a pandemic. And so that's going to be a very interesting discussion to see that through the lens of global public goods, to see vaccine equity and explore those types of topics that are really critical right now. And then from the lessons learned of COVID, we're really looking at our last session on larger frameworks of global health security. You know, how do we define and mechanize and put them into place these global health security frameworks in reference to pandemics. One of the reasons that this workshop, one of the intentions behind it, which I hope came through, was the lessons learned from past pandemic and epidemic responses, and also from what's happening now. What are our takeaways that we can apply forward for the next public health crisis? So thank you all again. It's such a dream to have gotten so many amazing people together. We're so thankful. And we hope to see you tomorrow at 10 a.m. Eastern Time.
Goodbye all. Thank you, thank you, thank you.